네, 다시 한 번 더 안내 말씀.
Once again, would I like to start the 6th MFDS GCFA shortly. The opening ceremony will start soon. The opening ceremony will start at 10 o'clock. So I kindly ask you to be seated for the opening ceremony. And for your reference, we do have the online streaming for this conference. So you can enjoy the conference at the MFDS official YouTube channel. So I kindly ask you to participate online too. And the presentation materials for this conference are available in the conference booklet distributed during registration. And also you can access via the QR code located in the back of your name tag. You can download the materials. And this conference will be provided with a simultaneous interpretation service. So you can utilize receiver on the table. The channel 1 is for Korean and channel 2 is for English. And for the smooth operation of the event, I kindly ask you to set your mobile phone into silent or vibrate mode.
Make your way to the venue and take your seats. Today's simultaneous interpretation will be provided during the conference. So if you need it, please use the receiver on your table. Channel 1 is for Korean, channel 2 for English. Please note that. 네, 이제 행사를
So would like to start the event shortly, so I kindly ask you to be seated. And you can utilize the receiver on the table for the interpretation service. Channel 1 is for Korean and channel 2 is for English.
we are going to begin the opening ceremony for today. So please make your way to the venue and take your seats. And we provide the simultaneous interpretation during the conference. So if you need it, please use the receiver on your table. Channel 1 is for Korean, channel 2 for English.
항생제를 올바르게 사용하지 않으면 생기는 내성. 이제는 전 세계가 함께 대응해야 할 중요한 과제입니다. 식품의약품안전처는 글로벌 과제 대응을 위해 2021년부터 매년 식품유래 항생 내성 국제 컨퍼런스를 개최하며 국제사회와 함께 대응 방안을 논의하고 협력을 선도하고 있습니다.
네, 인상적인 오프닝.
Well, that was a very astonishing video to share. Welcome, everyone. Thank you very much for participating in the 6th MFDS Global Conference on Foodborne Antimicrobial Resistance. I really thank you for participating in this event online and offline. Currently, the conference is being streamed lively on the YouTube. Thank you very much. Well, this is a very meaningful occasion. My name is Yeonjin Kim, the MC for today's event of the 6th MFDS Global Conference on the Foodborne Antimicrobial Resistance. So now in its 6th year, the MFDS GCFA has been organized to share global response strategies and policy directions regarding foodborne antimicrobial resistance and to strengthen international cooperation. And this year's conference, held under the theme A New Horizon for Foodborne AMR Response, Building Big Data and Innovating Global Food Safety Management, will bring together distinguished experts to engage in in-depth discussions and share the value of insights on the topic. So if I go over the agenda, we will have the opening ceremony, and then we will have the global policies, trend, and the national strategies for foodborne AMR response as the first session. And following the lunch time, then we will have the second session and the third session. And so the session 2 will discuss the innovations in AMR response using cutting-edge technology and AI. And session 3 will be on data-driven integrated management of AMR in the food supply chain and international cooperation. And in the lobby, you will be able to enjoy the e-posters and also the K-Food exhibition zone, where you can see many different the presentations or the posters that you can see. So for this conference, the conference is also being live streamed through the official the YouTube channel of the MFDS, allowing participants to join without limitations of location. So we warmly encourage you to participate online as well. And one more time, for your convenience, the translation service is being provided. So you can utilize the receivers on the table for the translation service. Channel 1 is for Korean, channel 2 is for English. So now let us begin the opening ceremony of the 6th Global Conference on the foodborne antimicrobial resistance, where a wide range of topics will be explored, from the latest technologies to the national strategies and international cooperation.
네, 고맙습니다.
Thank you. First, we'd like to hear the opening remarks from Dr. Hyun Jung, the Director General of the Food Consumer Safety Bureau at the Ministry of Food and Drug Safety of the Republic of Korea. Please join me in welcoming her to the stage with a warm round of applause. 네, 안녕하십니까.
안녕하십니까.
Good morning. I am Hyun-Jang Kim, Director General of the Food Consumer Safety Bureau at the Ministry of Food and Drug Safety of the Republic of Korea. First of all, I'd like to express my sincere gratitude to you for joining us for the 6th MFDS Global Conference on the Foodborne Antimicrobial Resistance despite your busy schedules. This conference, under the theme A New Horizon for Foodborne AMR Response, Building Big Data and Innovating Global Food Safety Management, serves as a platform for experts from around the world to share the latest trends and experience in responding to foodborne AMR. Today, through the presentations by 11 experts from 9 countries, we aim to examine together the current status and challenges of AMR resistance response within the food supply chain. And also, we hope to engage in deeper discussions or expert workshop on strategies to address AMR in the food supply chain, and to foster practical dialogue that can contribute to policy development. And in addition, active communication between the presenters and participants is expected through the e-poster session. I hope today's conference will become a meaningful occasion to share experience and knowledge while exploring practical cooperation and policy solutions. Once again, I'd like to thank all the speakers and session chairs, as well as all the participants joining us both online and offline. Thank you very much.
네, 고맙습니다. 우리 김현정.
So thank you very much. So Director General Kim gave us a great speech to kick off the conference today. Today we are joined by many experts from 9 countries. So I'd like to thank everyone for honoring us with their presence. And I sincerely hope that today's conference will also serve as an opportunity to foster meaningful cooperation. Next, we would like to hear the welcome remarks. So the Oh Yu-kyung, Minister of the Ministry of Food and Drug Safety, sent us the video for her opening remarks. So let us watch the video. Good morning. I am Oh Yu-kyung, Minister of the Ministry of Food and Drug Safety of the Republic of Korea. Welcome to the 6th International Conference on Foodborne Antimicrobial Resistance. I would like to express my sincere appreciation to Assistant Director General Tanawa Tien-sin of FAO for his congratulatory remarks, as well as all the speakers and session chairs for their valuable contributions. Antimicrobial resistance transmitted through food requires an integrated management approach throughout the entire food chain from production to consumption. To achieve this, both science-based management founded on data and close international cooperation are essential. The Ministry of Food and Drug Safety is focusing on establishing an AMR management system utilizing advanced technologies such as AI. In addition, we are working in cooperation with the FAO to support capacity building efforts in Asia and Latin American countries. This conference is also being held in connection with the Atlas 2026. I sincerely hope that this conference will serve us as a meaningful opportunity to share the importance of addressing AMR with the international community and to explore practical response strategies based on the policy experiences of each country. So thank you very much. Although she could not be with us in presence offline, but she sent us the video for her opening remarks. So I'd like to thank the Minister Oh Yu-kyung of the MFDS. Next, we would like to hear the congratulatory remarks. So the Tanawa Tien-sin, Assistant Director General of FAO, has also sent us the video. So let us watch the video.
Honorable Ministers for Food and Drug Safety of the Republic of Korea, Dr. Oh Yu-kyung, Excellencies, distinguished delegates, experts, ladies and gentlemen. Good morning, Annyeonghaseyo. It is my great honor to extend my warm welcome and congratulations to the 6th Global Conference on Foodborne Antimicrobial Resistance. I would like to express FAO's sincere appreciation to the government of Republic of Korea, and in particular, the Ministry of Food and Drug Safety, for its strong leadership and continued commitment to advancing the global agenda on foodborne AMR. The antimicrobial resistance, or AMR, remains one of the most serious global challenges in our time. It threatens human health, animal health, livestock productions, food security, food safety, livelihoods, and the sustainability of our agri-food system and our health systems. FAO projections show that under a business as usual scenario, if we do nothing, antimicrobial use in livestock production could increase by nearly 30% by 2040. Today, the overuse and misuse of antimicrobial in livestock production, aquaculture, and plant production contribute to the growing threat of AMR and create important food safety concerns. But this is also a hope. We know that transformation is possible. If we want to change, we can do together by improving animal health, strengthening biosecurities, increasing productivities, and promoting alternative and innovations. Antimicrobial use could be reduced by up to 57%. This is why in 2024, FAO launched the global initiative RenoFarm, reduce the need for antimicrobials on farms for sustainable agri-food system transformation. RenoFarm supports countries, farmers, producers, researchers, and partners in building more sustainable agri-food system with less dependence on antimicrobials. It is about prevention, innovation, and working together to protect the effectiveness of antimicrobials for future generations. To make sure that when we get sick tomorrow, if our animal gets sick tomorrow, we have medicine, we have antimicrobials to treat ourselves, our children, or our animals. The Republic of Korea has played a key role in this global effort. Since launching the RenoFarm initiative in 2024, we make important progress together in strengthening capacities, improving regulatory frameworks, and promoting the implementation of Codex standards to contain foodborne AMR, thereby contributing to stronger global AMR governance. Through initiatives such as the actions to support implementation of Codex AMR Text Acts project and the International FAO Antimicrobial Resistance Monitoring System, or INFARM. Much progress has been made possible over the past year, thanks to partnerships among governments, international organizations, academia, farmers, producers, and the private sector. I'm pleased to update you that today, 80 countries are already participating in INFARM system, with 60 countries actively contributing data to INFARM system. Together, this represents more than 800,000 samples collected globally. In the coming months, we will launch the first global report on AMR surveillance and monitoring system in agri-food system. Addressing AMR requires strong collaboration across sectors and across borders. No single institution, country, or sector can tackle this challenge alone. Only through partnership and collective action can we achieve meaningful and lasting results. Therefore, this conference today has become a unique and highly valued platform, bringing together the international communities to address AMR from a food safety, to agri-food system perspective. Moving forward together, it is essential to continue advancing the One Health approach, recognizing the interconnectedness of human, animal, plant, soil, and environmental health. Only through coordinated action can we effectively reduce AMR and ensure safer agri-food system. Today's discussion is an important opportunity to strengthen our shared commitment. Let us continue to work together to translate knowledge into action. Thank you very much. 감사합니다.
Thank you very much. What's
Well, thank you for the sharing. Thank you for the video. Well, we are now clearly understanding how significant this conference is for all of us. So that was a really good reminder of the significance. So I once again appreciate Assistant Director General Dr. Thanawat Tiansin of FAO. Well, thank you very much. And before we start the session one, we'd like to have the commemorative photo session. So I kindly invite all the distinguished guests, invited speakers, and the session chairs attending on site to come up to the stage. And following the photo session, session one will begin after immediately. So please be seated.
commemorative photo session? So may I invite all the VIPs and speakers and moderators to the stage. 네, 그러면 이제 정면 카메라를 봐주시고 환한 미소를 보여주시면 고맙겠습니다. Please look at the camera. Smile, please. 네, 촬영 진행하겠습니다. 네. 다시 한번 정면 봐주실까요? Please look at the camera. Front side. 이번에는 포즈 한번 취해 보도록 하겠습니다. 하트, 파이팅, 파이팅 하고 하트 한번 가보겠습니다. Let's strike a pose like this. 자, 하나, 둘, 셋, 파이팅. One more. 다시 한번 다른 걸로 한번 가볼까요? 이번에는 Would you please show a small heart or Korean heart? Is it okay? 네. 스몰 하트 혹은 뭐 보라트도 좋습니다. 네, 자연스럽게 정면 봐주시고 환한 미소 지어주시면 좋겠습니다. 네, 마지막으로 박수 한번 치는 것으로 마무리하도록 할게요. Let's clap together. 네, 제가 포즈를 좀 많이 요청을 드렸는데요. 네, 함께해 주셔서 진심으로 고맙습니다. 자, 잠시만요. 저희 한 번 더 촬영하도록 하겠습니다. We would like to have one more photo session time. 자, 오늘 참석해 주신 분들 저희 또 귀한 발걸음 해주신 만큼 함께 해주시면 더 좋을 것 같은데요. 기념 촬영 진행하겠습니다. 아마 다 올라오셔도 괜찮을 것 같습니다. Would you please come up on the stage? We would like to have a group photo session. 자, 기념 촬영을 위해서 저희 함께 해주신 모든 분들을 모시고 저희 진행을 하도록 하겠습니다. Please squeeze in. 네, 여러분 좀 사이사이 네, 좀 거기까지만. 네네네. Please stay there. 네, 다시 한번 진행하겠습니다. 정면 카메라 봐주시고요. 네, smile please. 자, 이번에는 역시나 한번 파이팅부터 한번 가보겠습니다. 자, 하나, 둘, 셋 하면 파이팅입니다. 1, 2, 3, 파이팅! 하트 한번 가볼까요? 네. 네, 고맙습니다. 여기까지 하도록 하겠습니다. 함께 해주셔서 진심으로 고맙습니다. You may return to your seat. Thank you very much for joining this wonderful photo session. 자, 여러분들께서 이렇게
So thank you very much for your cooperation. Your presence shines the significance of this conference. And as introduced and as shared, the conference is being live streamed at this moment. So it's a hybrid conference where the online and offline participants can share the content together. So for the morning session, we will have the session 1, and after lunch, we will have the session 2 and session 3. So we will soon start the session 1. And session 1 will be held under the theme of the global policy trends and the national strategies for the foodborne AMR response, featuring presentations on the policies and response cases from from Europe, Germany, Japan, and Korea. Following the presentations by all the speakers, we will invite them to the stage for the discussion and the QA session. We will soon invite the chairperson for the session.
네, 기다려.
Thank you for your cooperation. We will start the session 1. And as I said, we will have the presentations, and then the Q&A and the discussion will follow the presentation. It is my great pleasure to introduce the chair of this session, the Professor Yu Han-sang of Seoul National University. Professor Yu is currently with the College of Veterinary Medicine at Seoul National University and received his PhD in the veterinary microbiology from the University of Minnesota in the U.S. He has contributed significantly to the advancement of the veterinary medicine and infectious disease research in Korea, having served as the president of the Korean Society of Veterinary Zoonoses and also of the Korean Society of the Veterinary Science and also of the Korean Association of Bovine Practitioners. In recognition of his contribution, he has received numerous honors, including the commendation from the Prime Minister and the Order of Service Merit. He has conducted extensive research on genomic analysis and molecular epidemiology. Please welcome him with a big round of applause.
네, 사회자님
So thank you for your kind introduction.
한상유 from Seoul National University. So it's my great honor to be here as chair of the session 1 of this 6th MDFS Global Conference and Foodborne Antimicrobial Resistance. 우선 첫 번째 세션에
So again, it's an honor for me to serve as the chair of the first session. As mentioned by the MC today, we have 3 speakers for this session, and they're going to share their country's response strategies to AMR and how they establish the legal frameworks for AMR response. And after all the three presentations are over, we will have the Q&A session for around 20 minutes. So you can ask questions if you have anything. So let me first introduce the first speaker.
첫 번째
So the first presenter is Dr. Spencer Sender from Germany. Currently, Dr. Sender is working at the German Federal Office of Consumer Protection and Food Safety. And Dr. Sender received the teaching the students for the veterinary medicine and relevant law at the university.
Thank you very much for inviting me. It's a great honor to be here and especially to have the first talk of the first session. So thank you very much. And I really hope you will, I will bring something new to you. And I would like to share the experience from Europe, especially also from Germany. So we really, did very much on combating AMR on the last decades. So, and hopefully could somebody just explain me how to proceed with the technique here? That would be great. So, which these ones? Okay, great. Okay. So I just want to give you an overview first. So I will talk about the European strategies and actions to reduce AMR, European legislation, national strategies and legislation in Germany, and a little bit about our achievements and challenges. So we all know why we are here, and I think we heard it in the talks before here. AMR is a global health threat, and not only at the moment, but also the future perspectives are not very pink, to be honest, so we really need to tackle this problem. AMR is, as we heard before here, one health problem. So antibiotic resistance is transferred between bacteria, animals, humans, and the environment. In an increasingly globalized world, antibiotic resistance travels across national and continental borders. And this makes the fight against antibiotic resistance complex and requires coordinated countermeasures and activities at many levels. So to tackle this problem, the European Commission already implemented a Commission action plan in 2011. So, and the main goals of this action plan were to foster the appropriate use of antibiotics, to foster microbiological diagnosis, to prevent microbial infections, to develop effective antimicrobials, which is, to be honest, more in the field of the human medicines, as we in veterinary medicine will stick to the older ones, and the new antibiotics will be used in human medicine. Also, as we heard before here, joining forces with international partners and reinforcing research to foster innovative means to combat AMR. Afterwards, the European One Health Action Plan against AMR was implemented in 2017, and this was meant to make the European Union a best practice region, and it also had some more concrete goals. Communication is very important in this point, but also monitoring systems and so on. I don't want to go in this very deep. But the farm to fork strategy also picked the problem of AMR up. So, and that is quite of many consequences for the legal legislation in Europe. We really underwent we implemented strategies and legislation to also fulfill a goal which was set in from the farm to fork strategy. So the antibiotic use in farm animals and aquaculture is today reduced by 50% by the year 2030. And the baseline was set on 2018, so that's really a big goal we have here to fulfill. So to foster research and innovative methods, there are many European health research programs, and just to mention the Europe for Health program, which you can see here, has just a budget from in this year for 15 million euros to foster the One Health surveillance. So that is really one of the main big points here. Horizon Europe is also a research or a funding program. And I also want to mention the Mgallery project, which is, I think, really very successful. Most of the European member states are more in a project form working together on different fields to combat AMR. It's communication, surveillance, One Health reports, integrated surveillance. So there are more than 180 different authorities and institutions working on that at the moment. We also have the European Medicines Network, Agencies Network Strategy. So in Europe we have, on the one hand, the European Medicines Agency, which is responsible for centralized European medicines. On the other hand, we have the national competent authorities, which are also working on this field, but on national authorized medicines, and they together have a common strategy. And combating antimicrobial resistance has been really a main focus area in the strategy for many years. So in the first strategy and further on now too. So what happened to European legislation? Well, in 2003, the monitoring of zoonosis and zoonotic agents was implemented. So all European member states are obliged to collect, analyze, and publish relevant and comparable data on the occurrence of zoonosis and zoonotic agents and related antibiotic resistance. As part of zoonosis monitoring, data on the following antimicrobial resistances are collected: methicillin-resistant Staphylococcus aureus, ESBL and M producing E. coli, carbapenemase producing E. coli, and antimicrobial resistance and common cell E. coli. So these probes, so this data are collected from slaughtered animals, from healthy animals. And that's different to another monitoring program I will talk on later. So there's also been a ban on antibiotics as growth promotions in animal feed since 2006. So I think that's quite early. So it's forbidden to feed antibiotics to animals for the goal to foster a growth promotion. And we also have a ban of third and fourth cephalosporins for poultry. So since 2012, it's not allowed to use them in poultry. So it was considered that these medicines are quite important in the human sector and they shouldn't be used in poultry. So which was really, I think, the biggest change in the last decade was the new regulation for veterinary medicinal products. So before this came into force, we had all national regulations. We had a directive which set a frame set for all European member states, but the new regulation now here really did a harmonization of the law because it applies to every member state at the moment it came into force, so it had to be applied. The main objectives were harmonization, but also reducing administrative burden, which, to be honest, we are not sure at the moment if that really works. But strengthening European measures in the fight against AMR was also a main goal of this new legislation. So we had many measures in it, or have it. So a ban on prophylactic use of antibiotics in group of animals. There are restrictions on the metaphylactic use of antimicrobials, and there was a reinforced ban on the use of antimicrobials for growth promotion. It also contains a possibility to reserve certain antimicrobials for human use, and the obligation for member states to collect data on sales and use of antimicrobials. And there is also another regulation on medicated feed, which goes quite along with these goals too. So following this main European legislation, there was another implementing act, and we now have a list of antimicrobials which are reserved for the use in humans, and it's not allowed to use them in animals. So you can't apply for veterinary medicine with an ingredient of these active substances. You're not allowed to use it under cascade, which means we are allowed in Europe to use human medicines in animals, but just under certain circumstances, especially if you have specific needs, clinical needs. But these antibiotics or antimicrobials which are listed on this list are not allowed under any condition, and which might be important, or which is, I think, really important for third countries. It's also not allowed to import animals which were treated with these substances, and also the products of these animals. So that is very strict here. There was also a monitoring system introduced to collect comparable data on volume of sales and use of antimicrobials in veterinary medicine. And these data are annually published by the European Medicines Agency and in the ISO-VET report. And on the left side, you see just as an example, you can download it from the internet. Here, a regional illustration from the member states and the sales data. Well, the use data was implemented in 2023, the collection, so it's quite freshly implemented, and it's not yet well established. So you can't find very detailed data at the moment, but that will change in the future years, we are sure. So we also have a national strategy in Germany. It's called DART, Deutsche Antibiotikaresistenz Strategy. It was developed in 2008 to address the growing challenges in treating infectious diseases caused by antibiotic resistance. And part of this, I think, is kind of a hard piece, was our benchmarking system, which we'll explain you later a little bit. Also, in the national legislation is the GERM-VET project, or not project, well, it's really laid down in legislation. So it's a national resistance monitoring of veterinary pathogenic bacteria since 2001. So that's, I talked a little bit earlier here, it's really a difference between the zoonosis monitoring from healthy animals, which get into the food chain, and this monitoring system is for ill animals or for animals which are clinically ill. And we have about 3,000 isolates per year, which are identified, and regular reporting obligation of the BVL, that's the institution I work for, regarding resistance data from clinical isolates. So there's a specific sampling plan which takes current developments into account. And the objective of this monitoring system is to identify trends in development of resistance and to derive treatment options for practicing veterinarians and to assess the risk that may affect humans from the veterinary sector. So we also have pet animals, and also the farmers are dealing with the ill animals, and there are some risks deriving from that contact too. I told you that there is an obligation to collect sales data on the European level since 2023. In Germany, we first established the collection of use data in 2011, and we just made some amendments to get harmonized data for the European obligation. But in this monitoring system has proved to be a very stable monitoring system. We only have some few data providers. These are the marketing authorization holders and the wholesalers, so it's about 50, 52 each year, and they are very professional, so the data we get is really of high validity. The data is submitted to EMA, and it was submitted earlier on a project level, the SVAC project, and now by law of the veterinary regulation. We also submit these data to the WOAH, to the NMU global database, and we publish it on national level. And I also want to explain you or tell from our experience from the German antibiotic minimization concept. So that was introduced in 2014, and that is a benchmarking system where we collect use data for certain farm animals at farm level. So only farms which have a special size of animals are in this concept. And if farms have an above average use of antibiotics in comparison to other farms, which are with the same animal production types, they are targeted, and then there are some measures. So they have to establish a management plan and have to show how to reduce their use and work together with the veterinarians. The production types which are in this benchmarking system from the start were only the fattening animals, so cattle, calves, chicken, turkeys, pigs, and piglets. But since 2023, where we have any way to collect use data for many different animals due to the veterinarian European law, we added dairy cows, laying hens, young hens, breeding pigs, and suckling piglets. So the main objective of this benchmarking system is to reduce the use of antibiotics to the therapeutically required minimum. As we all know, it is necessary to treat animals which are infected, but you have always some farms which could improve by introducing other measurements, and so they should be tackled. And now just a short glimpse to our achievements. I think these are data on our, as I said, well-established sales monitoring system in Germany. And if you like, you can go on our database too and get some nice colored pictures. So we have here color-coded sales data, which is geo-referenced. So, and you see the high densities, which are dark red here in the areas where we have high farm animal productions. So that's not why the veterinarians, they are not responsible, but it's just because there are many farms. But you can see between 2011 and 2024, there has really been a nice reduction in almost every area and in Germany in the sales of antibiotics. And you can also see that when you just compare the years, and we here split it to the different active substance groups. And we introduced our benchmarking system in 2014, and already in 2015, we could really see a nice reduction in the use of antibiotics. So to sum up, antibiotic resistance is influenced by the use of antibiotics. It cannot be adequately addressed by one country alone and cannot be confined to a geographical region. The European One Health Action Plan against antimicrobial resistance addresses these aspects and aims for the European Union to become a best practice region. And the European Veterinary Medicinal Products Regulation, applying since 2022, strengthens the European actions to fight antimicrobial resistance by ensuring prudent and responsible use of antimicrobials in animals and collecting data on the sales and use of antimicrobials in animals. Collecting harmonized data at the international level is essential for developing strategies to reduce antibiotic use and antibiotic resistance and to follow up implemented measures. The legal requirements in Europe and Germany, along with other influencing factors like how many animals are on the production lines, to be honest. So we had a decrease in swine farms too during the timeline, have contributed to the drastic reduction in antibiotic use in Germany. But however, what we experience at the moment in light of global crisis, mounting economic pressures, and the objective of reducing bureaucracy, that's really a big point in Germany at the moment, it is becoming increasingly difficult to continue prioritizing the fight against AMR. That's a big challenge we experience. And I just want to mention here Ragnar. I'm not sure if you already know this meeting format or this network, and I promise to collect from there to just show it here if you're interested in joining. So that's a really good network fighting AMR. So thank you very much for your attention.
네, 발표.
Well, thank you very much for the presentation, including the Germany. It was a really good opportunity to understand how the AMR is being responded in terms of the policies and the regulations and legislations for the farm animals. So it would be a great opportunity. It was a great opportunity to learn about it. And during the Q&A session, we will be able to share the questions.
다음은 일본.
Next, we would like to hear from Japan. So the Michiko Kawanishi, Senior Research Officer of the Veterinary AMR Center at the National Veterinary Assay Laboratory, will give us the presentation.
Thank you. Thank you, Chair. Can you hear me?
Yes, you can.
Thank you very much. I'm sorry I cannot take part in this conference in person. And I appreciate to the GCFA secretary and all the organizers who inviting me to present Japan's approach to addressing antimicrobial resistance in livestock sector. I would like, I would like to move the next slide, but it cannot. So I'll take these whole topics. Now I'll start about the National Action Plan. In Japan, so the first action plan launched in 2016. Shortly after the WHO Global Action Plan was adopted. After reviewing the first action plan, Japan revised the National Action Plan in 2023. Japan's National Action Plan has 6 goals, and from 1 to 5 is aligned with the WHO Global Action Plan, and Japan added the 6th goal on international cooperation. The National Action Plan set the target for both AMR and also AMU. For AMR, one target is the resistance rate of E. coli isolated from healthy animal against tetracycline, which is most commonly used antimicrobial in livestock. Another target is the critical important antimicrobial for human health. These are target values. And also we set it AMU. AMU indicator is the use of the veterinary antimicrobial in livestock field. The target is the 15% reduction by 2027 compared to the 2020. Additionally, we set the indicator for the second-line drugs with a target to keep the 27 tons. It should not increase compared to the 2020 levels. These values are measured through the Japanese veterinary antimicrobial resistant monitoring, we call JBRM. The purpose of the JBRM is not only to provide indicator for the action plan. JBRM has launched in 1999. This meaning Japan began continuously veterinary AMR monitoring. This long history allows us to observe long-term trend, evaluate the effect of the intervention, and make policy decisions based on evidence rather than short-term observation. This figure shows the structure of the JBRM. The JBRM has three pillars. The first is the pink one, is the monitoring of sales amount of the antimicrobial, reported by the marketing authorization holder. Second one is the blue one. AMR surveillance monitoring in a healthy animal. The target bacteria, indicator bacteria, E. coli and Enterococcus, and foodborne pathogen is Salmonella and also the Campylobacter. The third is the yellow one, AMR monitoring in animal pathogen, isolated from the diseased animals. Now I move to the result of the JBRM. This slide shows the trend in veterinary antimicrobial sales for the livestock in Japan. Overall, the total volume has been decreasing in recent years, especially the 2018. Pink is a peak, so the peak is the largest contributor. Among the peak, tetracycline accounts for the large population, and the sales of the tetracycline in peak has decreasing about 15% since 2020. Here, we show a focus on second-line drugs. Our action plan targeted is 27 tons by 2027. The slide notes that now 2023 is the total ton is 23.5 tons. In Japan, colistin accounts for the large share within the second line drugs, and colistin is approved for the only pigs. And the second one is the fluoroquinolones. Now I move to the resistant rate result. A simple overall pattern is the resistant trend to the higher than pig and broiler rather than the cattle. And as you can see, the old and first-line drugs like the tetracycline, ampicillin is higher. While which is critically important for human health, like the ciprofloxacin, colistin, and cefotaxime is a very low level. Now we would like to share the action plan indicator. You see this slide is a tetracycline. Target value about the pig and broiler, the resistant rate is higher than the target value. In spite of that, as I before said, the sales volume of the pig is decreasing since 2018 in pigs. However, the resistant rate is stable. There are several possible factors contributing to this situation, and maybe the co-resistance with other antimicrobial is considered to be one of the reasons. For the third generation cephalosporin, the resistant rate in all animal species remain low, and below the target value. However, we look at the fluoroquinolone. The resistant rate in broiler isolate in 2023 exceeded target value. Although fluoroquinolone sales volume in broiler show a slightly decreasing trend in Japan, we continuously carefully monitoring is necessary about the fluoroquinolone in broiler. Till now, I have focused on the livestock sector, but AMR is the One Health issue. Now, I would like to show the One Health approach. In Japan, under the AMR One Health Surveillance Committee, human, animal, environmental sector share the data. For human, these national data are submitted, and from animal, our GBAM data, and also from the environment, these data are submitted to this committee. After consolidating these data, we published the Nippon AMR One Health report since 2017. It is available not in Japanese, also English version is published in this website. Now I give an example of the cross-sector comparison using the salmonella from healthy broiler, food, and human. Left side here shows the proportion of the salmonella serotype among isolate from each sector. As you can see, the Schwarzgrund infantis is major serotype in broiler and food, while from human salmonella make the very you can see the diversity. This is suggested that the possibility there is a variety origin from the salmonella salmonella in human, not only the broiler through the food, but another origin are suspected. Right figure shows the antimicrobial resistant rate by salmonella serotype, infantis and Schwarzgrund. As you can see, the Schwarzgrund, so the broiler, food, human, as you can see, the same resistant rate trend. While the infantis, you can see the human is a very different resistant rate show. It is also suggested that the human-derived infantis may have originated from the source other than the domestic broiler and also the chicken food. Here, we compare the resistant rate in E. coli from human and food-producing animal, healthy producing animal. As you can see, resistant rate to the, these two critical important antimicrobials resistance. So as you can see, isolated from human, continuously increasing trend. However, the isolated from the healthy animals, livestock sector, in recent years are very stable and low. The trend between isolated from human and animal differ. So this suggests that AMR issue seen in the human sector is not predominantly derived by the animal sector. Now I will talk about the risk analysis framework in Japan. This figure shows the risk analysis framework. risk analysis including the three components: risk management, risk assessment, and risk communication. In Japan, these frameworks align with the international standards, including Codex, Guideline, and the WHO Code. In the food safety area, Food Safety Commission conducts a risk assessment. And Ministry of Agriculture, our Ministry of Agriculture, and also Ministry of the Healthcare conduct the risk management with the coordinated the risk communication to stakeholders. This slide summarizes the structure of the risk assessment. We started with the hazard identification, and then we consider disease assessment. First, disease assessment, and next, exposure assessment, and then consequences assessment. These components are integrated into an overall and risk estimated. For evidence, we use our JBAM data and also human surveillance data such as JANICE data. Based on science-based risk assessment, Japan has implemented risk management measures. In the case of the veterinary drugs, if the risk estimates result in medium, we select these options, strict the use as a second-line choice drug, and also enhance the monitoring. Or about the heat additives, if the risk estimate result is not negligible, if there is any risk, we revocated it with the antimicrobials. So now, still now, Japan, these antimicrobials assigned as the second-line drugs, and also these antimicrobials already revocated. So we cannot use these antimicrobials as feed additives. Now we would like to show about the result of the risk analysis. Based on the risk assessment, colistin is designated as a feed additive, revocated, and also classified as a second-line drug for veterinary use in 2018. So we cannot use the feed additive since 2018, and designated as a second-line drug as veterinary medical product. So this line bar shows E. coli isolated from the disease peak. The resistant rate of colistin is rapidly decreases since these risk management this management conducted. In this case, JBAM data supported the entire policy cycle, from risk analysis to the regulatory decision making, and finally to post-implemented evaluation. Finally, I would like to show about the public awareness and education. Awareness raising is the key pillar of also the Japanese AMR strategy. We provided tailored information for professional and public, and also the pet owner, and also the farmer. On left, we share the guidance and the report for medical and veterinary professional. In center, we conduct public awareness activity and provide educational content via YouTube. On the right side, we offer the material for pet owners and highlighted good farmer practice through video. Now, I would like to summarize. Japan continues to implement the National Action Plan on AMR, promoting the prudent use of the antimicrobial use and maintaining and strengthening surveillance in livestock sector. Veterinary antimicrobial sales, including second-line antimicrobial, has decreasing, demonstrating the progress in prudent use, while the resistance to critical important antimicrobial remain low. No clear parallel trend in resistance between livestock and human clinical E. coli has been observed, suggesting a limited animal to human contribution. Science-based risk analysis in line with the international standards underpins risk management decision for veterinary antimicrobials. Japan promotes the sustainable livestock production through the vaccination, biosecurity, enhanced and continued responsible antimicrobial use. Thank you very much for your attention. Our laboratory moved from Tokyo to the Tsukuba in now the new facility. If you come to Japan, please come to our laboratory also. Thank you very much.
네, 감사합니다. 일본의
So thank you very much. So she shared the Japan's response strategies to AMR and also the national action plans. And also she talked about the Japan's efforts for risk analysis and surveillance. So thank you very much for that comprehensive presentation.
프로
So the next presenter will talk about the AMR response in Korea, and after that we will have the Q&A session. The third presenter is Scientific Director, Deputy Scientific Director Jung-eun Lee from the KDCA, and he will be talking about the national strategy for the AMR in Korea. Thank you very much for the kind introduction. My name is Jung Lee. And first of all, I really appreciate the organizer to give me an opportunity to present on the National Action Plan on AMR in the Republic of Korea. So I will briefly introduce KDCA and then go over the different topics and then also talk about the international cooperation. KDCA is protecting the health of the public against the infectious disease, and we focus on the communication security service and collaboration in order to develop the society toward a safer and healthier future. And as you see, we have the commissioner and also we have the 42 bureaus and the 35 divisions, and of that the AMR control is done by the Division of the Antimicrobial Resistance Control under the Department of the Healthcare Safety and Immunization. The division oversees the project and activities for the proper use of the antimicrobial and also improve the public awareness and also work in the international network for the cooperation. As you know, by WHO in 2019, the AMR was declared as one of the top 10 global public health threats. And in 2019, 4.95 million deaths were associated with it. So the disease burden is really great. But the problem is that this disease burden is only expected to grow in the future. Compared to the OECD countries, Korea relatively use more amount of the antimicrobials. So it is important to address and control AMR in this country. For the AMR, the transmission route, in addition to that, we also have other factors, something that is unique to Korea. the Korean population is covered by the national health insurance. So we do have the universal coverage. So we have the very wide access to the public health service. But at the same time, the public awareness of the AMR is very low, and also the aging of the population is very fast. Starting from 2003, we have been establishing and implementing national AMR program across the different ministries. And from 2016, every 5 years, we established national action plan on AMR. And 2024, we launched the ASP pilot project based on the health insurance reimbursement system in Korea. And reflecting the updated global action plan from this year, we established the third national action plan, and it is in implementation status. So if you look at the NAP of Korea, we do have the legal and legislative foundation, and that is led by the government, and the government support, the financial support is provided, and every 5 years, the NAP is updated. From the very beginning, we recognize the interconnectedness of the different areas, including the animals and environment and others, and we also added plant areas. So now we are working together with the Ministry of Agriculture, Food and Rural Affairs, and Ministry of Environment, Ministry of Ocean and Fisheries, and the Rural Development and Administration, in addition to the KDCA and the Ministry of Health and Welfare and MFDS. And as you see, under the NAP, we have important priority areas. However, as you see, the first NAP laid a foundation, and the second NAP tried to manage AMR in different areas to keep humans safe and healthy. And this year, the NAP is trying to achieve sustainable health for the population through the AMR management. If you look at the more details of the first and the second NAP, you see that during the first round of the NAP, the reimbursement to the IP was introduced. So non-human sector was the area where we participated for the first time. So we monitored MAOU and an AMR in companion animals and animal hospitals, and the multi-sectoral collaborations in the joint publication of the National AMR report in non-human sectors started. And during the second NIP, ASP pilot project was introduced, and also enlofloxacin was banned in the poultry. So it includes the aquaculture and the environment, so the scope has been fully expanded. And for the third NAP, the ensuring universal health coverage and protection of the vulnerable group, and strengthening community-based ASP network, all sectors, and strengthening multi-sector governance, and reflecting international trends like the global action plan. So these are the directions for the third NAP. And here, the basic goals of the NAP includes to preserve the therapeutic efficacy of antibiotics, and also minimize the emergence of the AMR. So the responsible use and prioritized use of access by antibiotics and protection of critically important antimicrobials and infection preventions. These four are the key indicators for the third NAP. And the different organizations have their own roles and responsibility. As you see, now we have the Rural Development Administration working together for the first time. And for these 4 priority areas and the 13 key actions for the third NAP, as you can see, that institutionalizing the ASP through the reimbursement program and strengthening infra for the optimal use and promoting prudent use in agriculture and aquaculture would be very important topic. And if I detail more on the ASP, this is the pilot project for the antimicrobial stewardship program in Korea. It started from 2024. And when it comes to the dedicated personnel for the ASP, it is not easy to acquire or designate a certain personnel. So in order to stabilize the ASP in this country, the government laid the lead so that they came with the many different guidelines and the system to implement ASP based on the National Health Insurance Reimbursement System. So within the hospitals in this country, ASP has not yet fully implemented. So the infrastructure is established for the large general hospitals, laying the foundation for the ASP extension in the future. For the future, the pilot project will be expanded to the smaller size of the hospitals by taking top-down approach. Currently, the general hospitals, 90 of the general hospitals with more than 300 beds are participating in this program. And after the COVID-19 pandemic, the infectious disease emerged more and the antimicrobials used more. So ASP is a really timely intervention. And the details of the ASP policy can be found from the JAMA Network Open publication that was well shared with the experts in other countries. So the countries where the ASP is to be introduced can refer to this kind of a program that we have been implementing in this country. From 2016, we have been following the WHO International Standard, which is the core glass. For different regions in this country, the big hospitals, 10 hospitals, collect strains, and these strains were analyzed, and genomic data and the pathogen data from those samples are all accumulated. And cool glass is serving a very important role to identify antimicrobial resistant strains. So we are having our own guideline based on the WHO guideline. And last year, PDR candidate auris, which was first identified in this country, was reported to the WHO. Along with the cold glass, we do have the CRAMS. So it covers the smaller size of the hospitals and the nursing hospitals and the clinics. So as of 2024, 5,300 hospitals are participating here for the collection of data. The data collected and analyzed from these two systems are shared on an annual basis with the public. And as for the antimicrobial use, the proper use has been promoted at the hospital level. So the CONUS, which is to create antimicrobial use on all of the system, is adopted by the hospitals. So 90 general hospitals are mandatory to be a part of this system, and currently about 154 hospitals are part of it. So based on the surveillance system, for the third NAP, we will sophisticate in this system. So the surveillance system will be expanded to cover more general hospitals, and more in-depth analysis will be conducted. And the epidemiological data, including AMU and AMR, will be integrated. Not just the human, but also non-human sectors are covered by many different organizations in terms of the surveillance system. So non-human and human sectors are well connected in responding against the AMR. And the WHO glass is something that we update our data. And the same is true for the non-human sector as we provide and share the data with non-AMU. In 2024, COGLAS and COMS, 110 hospitals, their data are shared with the ASMR, glass AMR. And also the antimicrobial use data is also reported to the glass AMU, and glass fungi is the one that we will report the data officially from this year. We have been a part of the tracks from 2016, including human, animal, plant food, and environmental sectors. So we provide our progress and development on the NAP to the tracks. Although it may not be easy to do the comparison among different countries, but here the Korea is very strong in terms of the intergovernment and interagency cooperation. In 2025, the WHO-led JEE result support this. After the initial assessment in 2017, we had a second round of the JEE assessment. We got the full 5-point score, and 4 received a 4-point score. So compared to the initial assessment, you see that appropriate use of the antimicrobials in human and animals and agriculture, the score has been increased from the 4 to 5. And we also working as a WHO collaborating center, WHOCC. So KDCA, with the accumulated experience and knowledge, expertise, we will continue to share our public health initiatives with the global arena and contributing to the global public health. And as you know, there can be many reasons for the emergence of the AMR. And in order to address the AMR accordingly, we have to work in different sectors, including human, animals, food, and plant and aquaculture. So we are strongly collaborating among the different sectors to address that. Thank you very much for your attention. Well, thank you for the presentation. So we were able to learn the national approach by the Republic of Korea for the AMR, the first and second and the third round of the NAP, and the lessons learned from the previous NAP implementation. So now I like to invite 3 speakers from this session to have the Q&A session.
어떻게 모셔야 되나? 네. 흘러요.
So if you have any questions, feel free to share your question from the floor.
마이크 부탁드립니다. 여기 이 앞에.
Good morning and thank you. Good start of the conference. A question to the colleague from Germany. Thank you for your presentation, and good to see the examples that Europe or the EU has been setting regarding growth promotion. About that topic, some recent research emphasized the economic benefits of the growth promotion use. And so there might be the trend coming up that we should go back to using growth promotion if we look strictly at the economic benefits of those. Which message would you have to countries that would look at that from that perspective?
Is it? Yeah, great. Okay, thank you for your question. Yes, I think there's no way back, to be honest. Well, in Europe, to be honest, we have more the trend to, to downsize the farms in some respects, and it's not only to AMR, it's also for a different way of nutrition the people want to have. So I think that's not really overlapping with the whole world and the aspects you have to consider in other countries. But just for growth promotion, you really have a very continuous use of antibiotics in a really broad way, and that puts the risk of AMR on a very high level. So I really can just say it would be really just backwards and you produce many, many problems if you implement it back.
예, 감사합니다.
Thank you. I am Myeong-shin Choi, working at FAO. I want to ask a question to Jung-eun Lee from KDCA. I really enjoyed your presentation, and it was a good opportunity to learn about the Korea's NAP and the achievement of the program. When it comes to the AMR, it is not just about the human sector, but also non-human animals and environment. So it requires coordinated and concerted efforts. So for Korea, human, plants, animal, and environment, are there any research that connects all different sectors? Do you have any specific data to cover that interconnectedness? And if not, do you have any plan for that? And as shared, starting from this year, 6 organizations, ministries start to work together involving Rural Development Administration from this year. And we also have the expert panel committee for the legal aspect, and the officials from the different ministries work together as a team. So we are working together for the cooperation. For the data, as I said, the integrated data for non-human and human sector started to be published from last year, and this is something new. So from this year, we will make some development and improvements to this integrated data, and we will refer to and learn from other countries' data and publication so that we can actually sophisticate in such a data collection and analysis.
질문하실 분은
So again, if you have any question, maybe before asking your question, please please introduce yourself. I have a question to the Michiko Kawanesh from Japan. So in your presentation, you talked about the salmonella in human, and it somehow generates from the infantus of the salmonella in broiler. And it was very interesting because the salmonella enteritis or salmonella typhimurium. So this is a typical, but here you can see the foodborne illness caused by the salmonella infantis from broiler. So regarding this, for the broiler farms, do you have any kind of policies to reduce the salmonella infantis for the broiler farms? For your reference, in Korea, we have the salmonella plurulum or gallinarum. We only have the slaughter policies for these. And salmonella enteritis or typhimurium or infantis, we don't really have the management policies, so there's kind of blind spot. So I wonder whether the Japan has any policies for these.
Thank you very much for your questions. So as you say, the Salmonella short-grunt infantis is not the disease, any disease makes for the poultry itself. So only this is the cause of the food poisoning to the affected to the human. And not to the broiler, but for the layer, we have vaccine for the Salmonella infantis and typhimurium and enteritis. So, and however, we have no vaccine for the broiler. So now maybe that not only for targeted to the infantis typhimurium, that it is maybe the very important thing is that the hygiene process. So the processing during the processing, to prevent the contamination from the Salmonella is maybe it is the way to prevent. I think so. Thank you very much.
또 네.
Any other questions?
Thank you very much. My name is Amina Bajwa, and I'm from FAO, Pakistan. So my question is for the two presenters here in person with us. So I understand that your countries, they really strengthen the control through regulation and surveillance. What about the demand side of antibiotics? Have you contributed, or did the country lead any behavior change or awareness interventions through targeting of farmers and veterinarians to reduce the use, or was it more of a supply side and not demand-driven campaign? Thank you.
Dr. Sanders first.
Okay, yeah, so I will start. Thank you very much for this question. Well, I think the benchmarking system I showed you, that was really very concrete, addressing farmers and veterinarians. So if the use of antibiotics is over average in these farms, they really have to undergo specific measures. They have to implement a different management, and it's by law. So that's not that's very strict. We also have campaigns, and we also try to address by communication this problem, but that's not so easy, to be honest. I think the first way we went were by legislation. But, well, I'm from the veterinary medicine sector and from the Department of Veterinary Medicines, so we also realize you have to tackle those problems from many different ways, and you need to look on the housing, on hygiene, and this can't be implemented in veterinary medicinal law. So you need all the other sectors which are more, in the animal sector and farmers to do their job too. So, yeah.
Well, in Korea, for the third National Action Plan, actually we do have the public awareness category as a key priority. So the public awareness campaigns is being done for the different group of professionals and workers. And not only that, non-human and human sectors are included and integrated into one content. So the integrated content that can cover both sectors are being developed from this year. And not only that, the husbandry or the environment for the farm needs to be improved so that the antimicrobials can be prevented for use. So that's being done, and the vaccination is also being done. So that we're trying to encourage the farmers not to use antimicrobials from the very beginning. And the third week of November, for the Public Awareness Week, designated by the WHO, is fully utilized in this country. So the media report a lot of articles on the AMR, letting the public understand the issues and the challenges from the AMR and how these issues can be addressed.
Sivakuti from FAO Nepal. I have one question to Michiko-san. So, in Nepal, like regarding the use of colistin in livestock sector, we are trying our best to ban the use of colistin in the animal health sector, following the international guidelines and the WHO recommendations as well. And it is being used illegally. That's like we are considered as a problem. But in Japan, you said like whether in the feed or in the treatment. But in Japan, it is being regularly used in the pigs. So is there any consideration of, like this use of colistin in terms of international recommendation being considered in Japan? It's about regarding the use of colistin in animal health sector.
Thank you very much for your question. So as I presented at my presentation, so that we decided how to use the antimicrobials, each antimicrobial based on the risk analysis. So the cause of the based on the risk assessment is the medium of the colistin. So that I designated the use colistin as a second line drugs in veterinary product. So before we use the colistin as a first line drugs, now we use the colistin as a second line drugs. And little by little, the volume of the colistin which are used in Japan for pig decreasing. And we are promoting that now we are introduce the vaccine for the edema of the pig, which are used for treat the colistin. So we would like to promote the use the vaccine more and more in Japan, and we would like to decrease the colistin. But I think the colistin is maybe the prohibited to the feed additives, but the in many countries also used as the sort of veterinary medical product. Maybe that is one of the very useful tools. But we would like to keep the usefulness to prudent use. So, yeah, thank you very much.
네, 혹시 다른 분 또?
Any other questions?
맨 뒤부터 받도록 하겠습니다.
제가 손은 엄청 많이 들었는데.
So I see many participants raising hands.
보겠습니다.
I have a question to the Japanese speaker. So in Japan, you showed us the AMU and also the colistin. Except for colistin, the feed additives are allowed, but still starting from 2018, total AMU declined and also AMR declined. So that's an overall trend. But in Korea, although we banned the use of antibiotics in Korea, but still we see an upward trend. So how could Japan enable such a decline in AMR and AMU? What were the successful factors?
Thank you very much for your question. So the declaration of the AMU is mainly driven by the pig sector. So maybe the most used antimicrobials in Japan livestock sector is the pig sector. So we discussed with the association of the veterinarian of the pig association. So before we establish the national action plan, maybe the association of the veterinary of pig is very effectively progress the prudent use. So they consider in Japan that maybe the pig is the most of, how can I say, the bad situation compared to the other livestock sector. Maybe the pig sector veterinarian considers that it is needed to change to how to use the antimicrobial, so that I can see that they how they make the effort to decrease the antimicrobial. I'm sorry, can I? This is my
감사합니다.
answer of your question.
Thank you.
Thank you very much.
그리고 이제 한 가지 질문은 우리나라 그
And the other question goes to Dr. Lee of the KDCA. I see that there has been many improvement made for the non-human sector too here. Well, following the European practice, Korea prohibit the addition of the antimicrobials into the feed, but the use of the antimicrobial has not been greatly decreased. So there should be some fundamental issue that we need to address. So you talked about the veterinarian prescription. That tension has been stayed with us for many, many years, impacting on the prescription sector for the human. And as in this case, for the non-human sector, is it only a way to do so that we decrease the use of the antimicrobials? Well, thank you for the question. And although we are the leading organization here, but we do have the Ministry of Agriculture, Food and Rural Affairs. But when it comes to the veterinarian prescription for the antimicrobial, it means that antimicrobials needs to be used only when it is prescribed by the veterinarians. So that promotes the prudent use of the antimicrobials. That's what the government tries to do. And as you pointed out, there are some missing parts, and we will work to close the gap. And when it comes to the use of the antimicrobial, and the use has not been decreased, rather it is a little bit increased, and that is because of the structure of the farming and the livestock industry in Korea, and that should be also addressed by the relevant ministry. Thank you. I am Kwak Kyo-sun from GFID.
I have a question to the Japanese speaker. So in your presentation, you talked about the tetracycline, AMU, and also AMR. Both AMU and AMR are high in terms of tetracycline. And Korea, we actually have similar experiences, and therefore we have implemented the policies to reduce the use of tetracycline. So what about Japan? Have you ever reviewed or assessed? Do you do any kind of review or the risk assessment for the tetracycline?
Thank you very much for your question. So the tetracycline is already finished the risk analysis, risk assessment, and we risk assessment result is long. So the we manage the risk management measure is the still used as a first line drugs. But as I before presented, the resistant AMU of the pig sector decreased very rapidly, and the most of the decrease is tetracycline use is rapidly decreasing. So we think that, however, tetracycline resistant rate is still stable high. So we think that the use of the tetracycline we can successfully decreasing because of the prudent use of the veterinarian of the pig sector. However, the resistant rate is still high. Maybe we are checking the bacteria of the isolated from pig. So not only the tetracycline, but also the bacteria resistant to the ampicillin or the streptomycin or the another kind of the chloramfenicol. So maybe the co-selection is one of the cause of the resistant rate of the tetracycline stable, despite of the decreasing the amount of the sales volume. So that we would like to not only the tetracycline, but also all of the antimicrobial, maybe we would like to promote the prudent use. I think so. Thank you very much.
네, 혹시 또 다른 분?
Any other questions? Well, thank you. My name is Ji Won-jung from MFDS. I really enjoyed the three presentations. I want to ask a question to Dr. Svenja Sender from Germany. So for the minimization concept of the antibiotics, that was quite interesting to me. And successfully, the AMU has been decreased, so it's quite inspiring to us. So for the farms, the use data were collected, and then the farms that used more than average, those farms need to take measures. So the sales data is something that Korea is also collecting. And based on the legal requirement, Germany is collecting the data, the sales data. So collecting use data from farms, are there any difficulties to collect the use data from the farm, not the sales data? And because this is the regulation and law, are there any punishment taken for the farms that do not follow the necessary measures?
Thank you very much for the opportunity to go a little bit more detail in our benchmarking system. So yes, indeed, it's more complicated to get use data from farms than to get the sales data. As I just explained, sales data, we have professional data providers, and that are not such many ones. So when we introduced our benchmarking system, the farmers were in charge to provide the data, and we also need their animal numbers because they get into relation. So we want to have the treatments, treatment days, animal numbers in the farms over the year, and the animals treated, and that's what we need for getting our figures and to benchmark the farms. When we introduced the European law, we had to harmonize some things. So also with the obligation to provide use data for the European Medicines Agency, now the veterinarians are to report the data, because we need the data not only for the benchmarking system, also for the use in cats and dogs in some years. And we just realized we can manage different data providers. That would be too complicated. So now the veterinarians are in charge to provide this data. They're not very happy with that, but that's just how it is. And the farmers still provide us with the animal numbers. So yes, they need, we have, it's a little bit complicated, and in Germany, because we have a federal system, so we are the ones who analyze the data and who provide the treatment frequencies, which are there to be compared to the whole treatment frequency in the federal one. But just for the farm, there is another competent authority who is looking if they really provided the data. But it has consequences. They have to do that, and they have to pay if they don't follow the law.
네, 더 질문이 있으실 것 같기는.
Well, I believe that there can be some more questions, but because of the time constraint, we need to close the morning session. So I really appreciate the three speakers for their contribution, and also the audience, online and offline, for the participation. With that, we'd like to close the morning session. Thank you.
Very much.
네, 고맙습니다. 이것으로
So this will conclude the morning session, the session 1. So we would like to thank the moderator of the session as well as the three speakers. So why don't you give them a round of applause? And also I would like to thank the participants offline and online. Thank you very much for your participation. Now it's lunchtime, so until 1:30 from now on, we're going to have the lunch break. So invited speakers and also the moderators, you are invited to the gallery 3 and 4, where luncheon will be served. And for participants, we have prepared the beverages and refreshment and also some lunch. At the the foyer.
to gallery rooms. Gallery room 3-4, where lunch has been prepared, and all participants are invited to enjoy refreshments and light snacks at the coffee break area located in the lobby. Please note that. 네, 오후는 이제 1시 30분부터 이제 세션 2가 이곳에서 진행이 되겠습니다. 식사하시고 나루볼룸 저희 세션 2 바로 이어질 예정이니까요. 1시 30분 전에 미리 착석을 부탁드리겠습니다. 참가자분들께서는 시간에 늦지 않게 다 저희 1시 30분 세션 시작이니까요. 네, 함께 해주시면 고맙겠습니다. 자, 그러면 즐거운 식사 시간 보내십시오. 고맙습니다. 네, 안내 말씀드리겠습니다. 잠시 후 10분 뒤죠.
Announcement, we are going to begin in 10 minutes at 1:30. So we'll resume the afternoon session at 1:30. I understand that many participants are outside the hall, but please come inside and take your seat. And also, we are having a hybrid event, online and offline. And the event is now being live broadcast through the YouTube channel of the MFDS. And the presentation materials, you can get the download of the presentation materials from the book that you receive from the registration desk. And also, if you scan the QR code, which is in the rear side of your nameplate, you can also get the download of the presentation material. And also, simultaneous interpretation is available throughout the event. So channel 1 is for Korean and channel 2 is for English. So if you connect the earphone to the interpretation receiver, I think it will be automatically turned on. And also to collect your precious feedback, we are having the survey. So please scan this QR code to participate in the survey. You can also attend the online survey by scanning this QR code, or you can have the offline survey utilizing the paper that you received when you make the registration. So your feedback will be highly appreciated, and this is necessary for a better conference next year. And also, as a courtesy for others, I kindly ask you to switch your cell phones to mute mode or vibrate mode. So I will come back again at 1:30 to resume the conference.
네, 다시 한 번 더 안내 말씀.
Ladies and gentlemen, did you enjoy the lunch? So we are about the time to start the afternoon session. So for the afternoon session, I also kindly ask you to be seated. And also, for the afternoon session, I kindly also ask you to turn your cell phones into the vibration mode or the silence mode and make sure that your alarm is off. And we are providing simultaneous translation service. So you can utilize receiver on the table, Korean channel 1 and English channel 2. And the materials, the presentation materials are provided at the reception desk. And also you can scan on the QR code on your name tag to download the materials. So please enjoy the afternoon session with us.
Please, we're about to begin the afternoon session shortly, so please make your way to the venue and take your seats. I'd like to ask you to change your mobile phones on a silent mode for similar operation, and the simultaneous interpretation is also providing this session. So if you need it, please use the receiver on your table. Channel 1 is for Korean, channel 2 for English. Please note that. 네, 그리고 한 가지 더 안내 말씀을 드리면 여러분들의
One more announcement. We'd like to collect your feedback. So you can have the survey form from the reception desk, and your feedback will help us to prepare for the next conference. And online participants can also participate in the survey, so you can scan the QR code so that you can share your feedback with us.
화면에 나가고 있습니다. 네, 이제 시간이 됐.
So it's time to start the afternoon session. I believe that you enjoyed your lunch. So thank you for coming back for the afternoon session. We'd like to start the afternoon session of the 6th the MFDS GCFA. So for this session, we will discuss the innovations in foodborne AMR surveillance and mitigation using advanced technologies and AI. So we will first hear presentations from 3 distinguished speakers, followed by the discussion and also the Q&A session. And for this session 2, we have the chair, Director Ju In-sun of the MFDS. Director Ju currently serves as a director of the Microbiology Division, Food Risk Assessment Department at the NIFDS under the MFDS, and she received her PhD in food microbiology from Chungnam National University. She has devoted many years at the NIFDS to advance food safety and microbiology related works. And he is the lead of the national efforts for responding to the food poison and the national action on the AMR. Please welcome Dr. In-sun Ju with a big round of applause. Well, thank you. As introduced, my name is In-sun Ju from MFDS. So we now open the session 2. It is my great honor and pleasure to discuss the topic which is very interesting to us, advanced technology and AI. And before we start, I want to share that Dr. Joe Bartlett from Australia and New Zealand Fusens is not able to participate for this session because of the health issue. So it is quite unfortunate to have Dr. Bartlett here, and I hope that Dr. Bartlett quickly recover from the current condition. Substituting Dr. Bartlett, we do have Dr. Thomas Hugh to present on this. I really appreciate that.
말씀드린 대로 첨단
So we will now begin the session 2, Innovation in AMR Reduction using Cutting-Edge Technology and AI. And we have 3 presentations in store for this session. So the first presentation will be about the robotic antimicrobial susceptibility platform and also the Australia's AMR response strategy. So let me introduce the first speaker, Mr. Thomas Johnson. So he graduated from the Texas University, and he got his master's degree there. And currently, he is serving as a microbiologist and regulatory scientist at FSANS. And also, he is the chair of the microbiologist committee of FSANS. And today, he'll be talking about the Australia's surveillance of AMR, utilizing the robot analysis. So please.
Hello, and thank you very much for this opportunity. My name is Thomas Johnson, microbiologist at FSANS. Today, I'm going to bring you together 2 different presentations. So the first will be an overview of the robotics platform developed by Murdoch University that was used in the analysis of our bacterial isolates from the FSANS study. And then I'll talk about some of the results from the survey completing the Australian national surveillance of AMR in raw retail meats. So the AMR genotyping and phenotyping work, which was led by collaborators at Murdoch University, especially by their leader, Professor Sam Abraham, using the robotic antimicrobial susceptibility platform that they developed. Although Sam isn't able to present today, I will walk through his material and highlight key features and validation results. The robotic platform and associated findings represented here are based on the work by the Murdoch team and do not represent views and positions of FSANS itself. Sam will be very happy to answer any questions via email that I'm unable to answer for you all. So the starting point for developing this platform was recognizing a fundamental limitation in how microbiology is traditionally done. Conventional workflows are low throughput, highly manual, and typically focus on very small number of isolates per sample. That approach itself simply doesn't capture the complexity of microbial populations, particularly when we're dealing with AMR, which is often heterogeneous and unevenly distributed. So the question Murdoch asked was, how do they move from analyzing single isolates to analyzing populations at scale? The Murdoch solution was to design a system that could process large numbers of samples and, importantly, large numbers of colonies per sample. The aim was not just throughput for its own sake, but to better represent what is actually present in the system, whether it's in animals, food, or the production environment. To do that, Murdoch integrated robotics, microbiology, and genomics into a single workflow. The platform itself integrates several key technologies, including automated plating systems, robotic colony picking, MALDI-TOF for rapid identification, high throughput susceptibility testing, both phenotypic and genotypic, and then downstream sequencing. These are linked into a single trackable workflow using fully integrated barcode capabilities, allowing Murdoch to move from raw samples to detailed, resistant data in a highly standardized way. So I have some videos I'd like to show you. So in this first video, samples come in and are plated using two-zone multi-dilution spiral plating, and then incubated. So colonies are grown overnight and on agar plates, and robotic stations are trained to automatically detect and pick colonies. Traditional surveillance typically selects only one colony per sample. The robotics here are flexible and can select anywhere from 1 to 96 colonies per plate. When a large number are selected, it can capture greater diversity in the bacterial population. Samples can then also be stored, frozen, or sent for subsequent testing. So robotics can also handle the transfer of MALDI-TOF for identification. So it provides rapid species-level identification of bacteria integrated into robotic workflows, high-throughput processing, and confirmation of which organisms are being tested before susceptibility testing is done, linking the identity of isolates to resistant profiles for downstream analysis. Robotic systems are trained to transfer picked colonies into microtiter plates, so the robots precisely dispense isolates into wells containing defined antimicrobial concentrations. The system is programmed to follow standard minimum inhibitory concentrations testing layouts, so MIC testing layouts that are CLSI compliant. Robotics ensure consistent inoculation, dilution, and plate setups across all sample. This enables high throughput processing of large number of isolates in parallel, minimizing manual handling and reducing variability between tests, producing standardized quantitative susceptibility data for each isolate, and all results are automatically linked back to the sample and colony metadata. So a published validation study is available. This evaluated the performance of the robotic platform directly against experienced human technicians. So the first experiment, they focused on reproducibility. So essentially, whether the robot could generate consistent MIC results across multiple replicates of the same isolate. And what they found was that the results were highly consistent with the expected variation for standard methods. In the second experiment, which I show here, So these results, they were looking at agreement more broadly. So comparing robotic, so that's the side, robotic generated MICs to human generated MICs and see how they correlated. So this was across 91 E. coli isolates with a wide range of resistant profiles. This was shown that the system performed very well across real biological diversity and not just in controlled conditions. The study also applied the platform in a real-world setting using fecal samples and analyzing multiple isolates per animal, rather than relying on a single colony. In terms of key findings, the platform showed high reproducibility, with MIC values remaining within acceptable variation. There's also strong agreement with manual testing, with the correlation coefficient of 0.967. So now I'm putting my Fizan's hat back on. I'm going to go over some of the results that we had in our national surveillance study. So Australia's response recognizes that AMR affects human and animal health, agriculture, food, and the environment, and requires a true One Health approach. However, very few nationally representative studies of food have been undertaken. As part of the national strategy, FISANS has been funded by the Australian Government Department of Health to undertake a year of surveillance looking at antimicrobial resistant bacteria in the Australian retail food supply. The project aligns with Object 5 of the 2020 strategy for AMR and has provided a key opportunity to advance the evidence base for AMR in retail food. I'm not going to go over the development and methods in detail here, but these have been previously addressed. So 2 years ago, Zoe Bartlett, who was the lead and project manager and was supposed to present this today, presented on how we developed the study. So at a high level, our food sampling strategy followed international guidelines to ensure reliability and robust and unbiased results. The methods were robust and developed by a group of experts. We prioritized chicken, beef, and pork based on a ranking matrix and targeted key bacteria including E. coli, Enterococcus, Salmonella, and Campylobacter. Samples were collected from major cities covering 60% of the population of Australia and sourced from a mix of large supermarkets, small supermarkets, and butchers to reflect consumer habits. Sampling ran for 40 weeks with random distribution and temporal balance to avoid seasonal bias. Samples were transported to multiple labs to ensure timely processing, and only those meeting strict quality standards were analyzed. We primarily used Australian standard methods for bacterial detection, followed by advanced identification using MALDI-TOF MS. Antibiotic resistance was tested phenotypically using CLSI and UCAST methods, and genotypically using whole genome sequencing. And as previously said, the antimicrobial susceptibility testing component was undertaken by Murdoch University. So just quickly, our report itself is structured in a way to be digestible for many different audiences. So we produced 3 linked components: an accessible summary for broad audiences at the beginning, and then a full technical report that explains concepts up front and methods in detail, and then supplementary tables for transparency and reproducibility. Together, they're designed to balance the scientific rigor and clarity so that different audiences can engage. So let's go over some key results. We tested raw beef, chicken, pork from supermarkets. So E. coli was found in 60% of samples across all meats. We also looked at Enterococcus and found about 77 to 84% of samples, including two types of Faecalis and then Faecium, were tested. These were tested further because they're more important for public health. Salmonella was found in 8.7% of chicken samples and only 2.5% of pork samples. And Campylobacter was found in 62% of chicken samples. In total, we isolated 2,452 bacterial samples that were sent to antimicrobial susceptibility testing. So here I'm showing from our summary report E. coli and AMR, resistant found in E. coli. So for beef, chicken, and pork, most E. coli in beef, about 81%, shown here, and chicken, 66%, were not resistant to any antibiotics, so they were fully susceptible. Pork had lower rates, so with only 44% showing no resistance to any of the tested antibiotics. When it comes to antibiotics, it's really important for treating serious infections in people that resistance is low. And we show that for when it comes to these high important antibiotics, the ones that are truly important for human health, that E. coli is rare to very low, or low in chicken and pork. The one thing we did find was about 25% of pork samples had multi-drug resistant E. coli, compared to 4% in beef and 7% in chicken. And this is something we need to keep an eye on and continue to look at in the future. AMR detection in Enterococcus. So in beef, 78% were found to be fully susceptible to antibiotics, and in pork, 65%, while in chicken had lower rates at about 47%, showing no resistance at all to antibiotics tested. Resistance to antibiotics for high important ones was very rare across all meats, from 0 to 3%, and multi-drug resistance was also low. For salmonella, the results were reassuring that only that 92% of samples weren't resistant to any tested antibiotic, and none of the bacteria showed resistance to any high importance antibiotics. And these findings suggest that the risk for antibiotic-resistant salmonella from chicken meat is very low and is a positive sign for food safety and public health. This slide shows two different Campylobacter, so coli and jejuni, so for raw meat, chicken meat, and how they responded to antibiotics. So for Campylobacter coli, 97% were not resistant to any antibiotics, and resistance to high important antibiotics was very low. Only about 0.5% showed multi-drug resistance. For jejuni, 80% were completely susceptible, but resistance to high important antibiotics was moderate at 16%. This finding is of interest because the high importance antibiotics are quinolones, so ciprofloxacin and nalidixic acid, and these have never been registered for use in food producing animals in Australia. This moderate resistance to ciprofloxacin in Campylobacter jejuni also aligns with what we're seeing in Australian poultry and human samples, but also internationally as well. Australia's ban on fluoroquinolones, along with a strong border controls and geographic isolation, likely helps keep resistance lower than in other countries, but still demonstrates why we need to keep monitoring and maintain strong food safety practices long term. So this graph shows that clinical and ECOF results for the two CAMPI species with jejuni down at the bottom. And you can see here that ciprofloxacin resistance on the left, and then on the right, this is tetracycline resistance, were commonly reported in combination together. And this is something that has also been observed internationally. This study we also compared to a 2007 survey. While the two studies use different methods and can't directly be compared, no major differences in resistance were seen. And using sort of a crude measure of where confidence intervals do not overlap, except for possibly Campylobacter jejuni, which may be showing more resistance in quinolones. So shown here, and nalidixic acid might be the only differences we see from the 2007 study. So just to go over some of the key outcomes. So overall, the public health risk is low. The findings suggest low likelihood of AMR transmission to consumers from raw retail meats, provided standard production, processing, cooking, and food handling practices are followed. Resistance to critically important antimicrobials is also generally low, with low prevalence of resistance observed in these high important antibiotics. High levels of susceptibility were observed for all tested products, and targeted resistance was observed in Campylobacter from chicken. Now, these moderate levels of resistance to ciprofloxacin were identified in jejuni, as I said, and because quinolones are not registered for use in Australian livestock, this finding is something to continue to look into. And because it's consistent with global patterns, is something for the global audience and researchers to look into. So the findings themselves are consistent with an effective antimicrobial stewardship within Australia. And one thing to remember is food safety practices remain a key risk mitigation measure. So good hygiene, good cooking, and you can save yourself from potential AMR exposure. So there I have a lot of acknowledgements. FSANZ coordinated and developed this survey plan, and but hundreds of people were involved, especially in going out and sampling. So hundreds of people from states and territory departments, and then also all the work done by the Murdoch University in their lab to do using their robotics technology. And then of course I want to thank Zoe Bartlett, our leader and project manager, who sadly couldn't be here today. And thank you very much.
예, 감사합니다.
So thank you very much. For this session 2, after each presentation is over, we would like to have the Q&A. So for that first presentation of the session 2, if you have any questions, please raise your hand and we will give you the microphone. So we can entertain questions for about 5 to 7 minutes.
호주는
So in Australia, for the veterinary antibiotics, I understand that you allow that, but the resistance AMR is very low. What are the reasons behind that low AMR, despite the use of the antibiotics for animal use?
It's a good question. Probably better answered by people from the Department of Agriculture, but I think I would say that there's a true commitment to stewardship, which means when it comes to antimicrobial medicines, which means not using as much and only using what is needed. I think it's a committed effort behind the vet community in Australia that has seen us ability to use those that are allowed in animals while not overusing to a point where you'll see a rise in AMR.
Hello, nice presentation. This is Sakar Sivakuti from FAO Nepal. So in Nepal also, like when we did AMR surveillance, we found out that we have a kind of a haphazard use of antimicrobials in Nepal though, but even though those antibiotics that are used or reserved for human purposes or human use that are not being used in the animals, we have been able to see some resistance on that as well. So in your study, is there any examples of cross-resistance that antibiotics that are not being used or critically important for humans being seen in animals? Is there any examples so that you can let us know about that? Thank you.
Thank you. Yeah, that's a really good question. So in this survey itself, we did not directly look for residues in the food, but we did, so Fazan's does a total diet study. And in the most recent one, they looked for antimicrobial residues in these same food products, just because we thought that this question would come up, and they didn't find any residues in the antimicrobials that we test, or for the resistance that we tested for. So, but it wasn't a large survey, but at least in the small amount of evidence we haven't seen that yet. But it's definitely something that would be worth looking into in the future for a larger study. But yeah, that's a really good question.
예, 감사합니다만 이제 시간.
So thank you very much, and I think time is up, so we'll move on to the next presentation.
Also, the presentation material was very good to learn about the Australia and New Zealand case. So we can share the questions later and even through the email.
예.
So moving to the second presentation of the session, the presenter is Dr. Junia Foodborne. Dr. Foodborne is the program lead at the National Institute of Food and Agriculture, and she completed her study in microbiology and biology from Harvard University and undergraduate studies in biology at Rollins College. So the AMR, the national support and the grant support for that research is the area she is leading. And she is an expert in the relevant research support and the entire microbial resistance and foodborne pathogen and next generation sequencing research and others. Today, Dr. Foodborne will deliver the presentation on the reducing antimicrobial resistance using cutting-edge technologies and AI. Please welcome.
Right. 안녕하세요. 저는 주니아 진자우 보브런입니다. 오늘 발표를 할 수 있게 되어 감사합니다. And today I am representing the United States Department of Agriculture, specifically the National Institute of Food and Agriculture. I am a research microbiologist by training, but currently, as mentioned, I serve as a national program leader, overseeing the AMR program for the National Institute for Food and Agriculture. And I'm going to give a brief overview of what USDA does to try to mitigate antimicrobial resistance across our food supplies in agriculture. by looking at how we're leveraging cutting-edge technology in artificial intelligence to mitigate antimicrobial resistance. And to start with, USDA is a large agency, and our main purpose is we're responsible for protecting American agriculture and food supply. And one of the many things that USDA does is looking at how antimicrobial is an issue and a threat that we need to help minimize the risk. And from this table, what I wanted to demonstrate is we have a specific area that is focused the bottom right, where the Undersecretary of Research, Education, and Economics, that's the department that has the concentration of a lot of the research and science involved in AMR. And in that department, that's where my institute is also located, the National Institute of Food and Agriculture. And today I'm going to give some of the priorities and focuses that we have when it comes down to mitigating AMR in our food supplies. And then I will look over a few projects that we have funded related to AMR and mitigation across agriculture. A lot of these information will not be provided in the slides, but we do have the links, and you are welcome to go to the U.S. government website to look at some of the information that will be presented today. And the USDA overall, as I mentioned earlier, we have 3 areas that we focus on when it comes down to AMR. The first one is reducing disease and pathogen transmission to reduce the risk. So what we're looking at is how we can make our animals and our crop healthier. How can we imply different technology and different approaches to make sure that the animals, such as cows and poultry, are not being exposed to antimicrobial resistance or generate antimicrobial resistance that could potentially be an issue for public health. We also look at how we can promote biosecurity to make sure the food supply is secure so people can have food to eat. And we also look at the different aspect of food safety as well for the first focus. Then for the second focus of AMR, we look at how we can improve scientific knowledge based on what we currently have. And this is where the section that comes under the Secretary of Research Education comes into place. We have several offices that are focused on developing various research, which I will mention a few of them here as well today. And I mentioned earlier that you are welcome to look at the link later on to look at some of the programs that I am mentioning here in this presentation. So for the scientific improvement of knowledge, we are always looking at how we can improve our data infrastructure to provide a One Health approach to dealing with AMR. We're looking at the agriculture side, since we are the Department of Agriculture. We're looking at all that the food supplies, we are collaborating with the Food and Drug Administration. And then we also look at the public health, how's it impacting human lives, which we collaborate with the Center for Disease Control. So all these components of the different agencies come together to make sure overall we are trying to find ways to mitigate antimicrobial resistance. But we also look at how we can support science and research across the different sectors to reduce the risk. We also look at how we can improve information to look at where are the sources, what are the impacts, where are the pain points that are causing AMR to be an issue and a trend, so that way we can disseminate that information to steward, to reduce the exposure to AMR. And we also look at how we can survey, monitor, and do different type of research, education, and extension to reach out the information to the people who needs it most so they can make the changes that are necessary to address antimicrobial resistance. To that effect, as I'm keeping that slide on the screen, we have our Agricultural Research Service, which is the second bullet under the Undersecretary of Research of Education. And they have different approaches to address that. They look at creating databases and dashboard that where they can collect a lot of that information related to AMR, the trends, and the information, the gene detections, different aspect of AMR. They create databases where that information can be stored in-house, and it's publicly available. And that's why I mentioned the links are there that people can access it to see what's going on when it's related to AMR in agriculture. They also look at advanced diagnostic approaches, what kind of ways they can detect it faster, easier, and then that information can be shared with stakeholders and people who needs it the most. We also look at using bioinformatics and AI to do our data analysis. So that way, again, that information right now with the current technology, we can speed up the process. We can give the information in a real-time fashion with the goal to understand, to detect, to mitigate AMR across our agriculture settings and at the end, protect public health. Then we have a third section that is also we use to disseminate, collaborate, and distribute the information to different stakeholders. Now, when we use our database to do that, we have in this particular section as well, we have the different components. We have the agriculture side. We have offices or agencies that deal only with the animal and agriculture. We also have the research side, and we also have the funding side. And I'll cover a little bit of all these aspects. So for the Animal and Plant Health Inspection Agency, which we call APHIS, in that department, they create dashboard that it can house all the information related to animal-related impact with AMR. So that network is called the National Animal Health Laboratory Network. So that network helps us track antimicrobial use in food-producing animals and monitor the AMR trend. So the USDA used that to investigate as a tool to monitor these AMRs in domesticated animals, including livestock, poultry, and companion animals. So we do have a depository. That's one of the approaches and technology that we use that can house all that information. And anybody at any point you need access, you need to see what is happening in your region and has it happened before? Has these type of antimicrobial have been detected? These genes, are they present in other outbreaks? That network is a source that you can go to get that information. And as I mentioned, that is also publicly available. USDA also uses diagnostic approaches and technology, such as using things like biosensors. We try to use that as a point of contact, a point of care for detection. Then we use things like CRISPR technology to give us precise identification of resistant genes. So these tools, again, the goal is to have them at real time available to the end users so they can make timely decision and also timely intervention to reduce exposure to AMR. As I mentioned earlier in the beginning, we do use bioinformatics when we have genetic information. So there's a lot of work being done. Currently, we're using whole genome sequencing. So with the whole genome sequencing, we are obtaining these genomic information, and sometimes we get them from outbreak situations where there will be an outbreak, the isolates are collected, and then the genome are sequenced. We have depository for those genomes, and then we can use bioinformatics as well as now we're using artificial intelligence to help us do the analysis, quickly find the trend, what is happening, what was the possible source, so we can address it in a timely manner to reduce any kind of exposure and public health impact. So with these database sequence data and AI analysis tools, we are able to look for driving forces, the reservoirs for these AMR. What are the pinpoint that is causing these outbreaks, these kind of increase in AMR trend? So the USDA is working on kind of predictive models to identify those trends and predict emergence in AMR. And furthermore, most of that information, we don't keep it to ourselves. The point is to communicate and collaborate with our local offices or national offices, and we also try to communicate globally, trying to enhance the partnership and build trust so that when that information can come, we can share the information, we can disseminate that information to the stakeholders, and we can disseminate that information to the farmers, ranchers, and anyone that is impacted by this particular event or the need for the information, that information is shared. And then by that, we try to make sure all of our resources are based on science-based solution that will help us locally and globally. To that fact, the USDA also have a different network. I mentioned earlier we had the animal health network, which is focusing on domesticated animals. It focuses on livestock, poultry, and but we also have a more complex network that is in place that we use, again, technology, databases, and AI to collect information that is in collaboration with the Food and Drug Administration, FDA, and the Center for Disease Control, which is CDC, that we collaborate with them to gather, again, the environmental information, the food information, and the people information. In that network, it's used to collaborate domestically and internationally as well. And it's publicly available. Information can be gathered from there anytime. We use education, extension, and outreach to transfer that knowledge to agriculture community, to the public, and promote antimicrobial usage reduction. So this network is called the USA National Antimicrobial Resistance Monitoring System, or NARMS. And it's a collaboration between the three major agencies. And NARMS is a program that CDC also used to help protect public health by promoting information about emergent bacterial resistance in a way to make sure that the spread of antimicrobial and how infections are impacting people, with that information can be provided. So those are the main three components, the three main focus that AMR, as far as USDA, how we are using AMR. Now I want to transition quickly to how are we getting some of that information? The way we at USDA, we have a special department, which is where I actually reside, where we are a grant funding agency, and we fund extramural research, education, and extension. So a lot of us who work in that agency, we are there to provide opportunities for universities, nonprofits, small businesses, and individuals who are interested in doing research related to AMR and other facets that we also fund. In these research projects, we encourage people to be innovative and bring your ideas to the table. These proposals get reviewed and selected by peer review panel, and then we fund these research projects, and the information is shared with the USDA for us to continue to find better way for either regulatory approaches or in some cases just stewardship, way we can provide information to intervene when it comes down to AMR mitigation. So some of the things that we're looking for in some of those research is things like new vaccine. We look for diagnostics. We're looking for alternative ways to use that is not using antibiotics, other approaches people can use to still reduce bacterial load without necessarily having to use antibiotics. So we're looking for a research topic in bacteriophages. We're looking for prebiotics and probiotics, and as well as any kind of new technology, AI. We fund these type of projects to help us, again, create databases that will help us to get information to stakeholders to address various issues. So to that, I'm gonna mention a few of the projects that are currently ongoing that we have recently funded. And any of that information that you're interested in, I'll be happy to later on to send in that information. For example, We have a project ongoing right now that is about revealing antimicrobial resistance trend in food chain using machine learning tools. So that one, we're looking at how E. coli can be transmitted from cattle to human to beef that people will consume, and then from there spread to the environment through human beings. So in that study, we're looking for gaps. We're looking for gaps that the laboratory cannot give us, but then using a technology called random forest, which is a machine learning methodology that's going to help us predict missing resistant data, so that way we can do statistical analysis and identify trends in resistance that are over time. So this random forest technology is helping us, specifically using E. coli as an example, to collect data that normally we would not be able to get with the laboratory, because it's a One Health approach. It's covering too many areas. That this particular project from Cornell University with Dr. Casey Kaiser is providing us information to make better decision when it comes down to AMR. We have another project that currently funded, which is integrating host and microbial genomics in machine learning to predict diseases that are impacting dairy cow. So this particular project is developing high accurate AI driven model to predict how these cows in different scenarios are being impacted, and then how we can use antimicrobial to only the cows that are sick. So instead of giving vaccination to all of the cows, but by using this AI to predict which ones or identify which ones are actually impacted, we can tailor our antimicrobial usage specifically to the cows that are impacted, and thus reduce the usage of antimicrobials and reduce the risk of potentially causing an increase in antimicrobial resistance and resistant genes into our environment. So this is another way, again, that we're using current AI technology and machine learning to help us predict, to help us decide and find trend and really identify ways we can mitigate antimicrobial resistance. We have another project that it's using nanoparticles to enrich samples, and then they're using a DNA biosensing with your cell phone to actually look for potential genes. And this project is just to rapidly monitor the dynamic of things like salmonella and campylobacter infection in poultry farm and slaughter facilities. So these nanoparticles, when they are enriched in the environment, they can scan them and see if they're identifying some of these bacteria off of the food sample, and using that schematic to do analysis and then help us decide, have these samples been impacted with these contaminated product. And the last one that I'm going to share today, and we have more projects, but those are the ones that I wanted to highlight in this presentation. We're also looking for a solution to use antimicrobial microbials in lactating dairy cow. So we have a project that is also using machine learning and AI to do predictive algorithm to identify dairy cows that have been impacted by metritis diseases. And then we implement selective antimicrobial treatment just to the cows that have been impacted, and then reducing, again, in this particular instance, similar to the one I mentioned before, the usage of antimicrobial. In this instance, we're looking for stewardship. We're looking for reduction of usage by veterinary physicians, so that way, by reducing the usage of antimicrobials, we can also reduce antimicrobial resistance. And we can make sure that we're using best practices for antibiotics, and there it could be more cost effective at the end by reducing public health issues. So this is what the NIFA does. So the National Institute for Food and Agriculture, as I mentioned earlier, Our main focus is funding various research and making sure that research information is being shared with others, and that we're doing outreach to make sure that information get to the people that it needs to get to make informed decision, scientific-based information being shared with others. And we collaborate with other federal agencies and partners to make sure we are doing a One Health approach to address AMR. And so we focus on research, education, and extension. By that, we mean we fund the projects. We make sure the universities or the small businesses or the entities that are doing the research make sure that knowledge gain is actually shared with others and reach out to the people that needs it most. And so for our farm bill, that one is just to share information with how the USDA have these section divided. We focus on plant production. We do focus on animal production. We focus on food safety and nutrition, as well as we're looking at the environment, such as bioenergy. And then we're looking at the overall agriculture system and how we use technology to enhance our growth in future agriculture practices, and also how that's impacting the economics of agriculture, looking at farms in the rural area. So that's today conclude overall what I wanted to present today. But to summarize the overall goal of the USDA and NIFA is to, again, make sure that we are, as an agency, we are reaching out to the people that needs the information most. So the USDA Department of Agriculture, we are focusing on food impact. We are looking at agriculture impact, and we're looking for strategy to reduce the AMR risk across terrestrial and aquaculture in agriculture. And for our funded programs, we want to make sure we are looking for innovation in AMR, to investing in things like diagnostic, bioinformatics, and learning overall to address AMR issues. So if you have any question, I am open for question at this point.
네, 감사합니다.
Thank you very much. While the speaker share the focus at the USDA in terms of the AMR. So that was a very good overview to learn. And whole genome sequencing, utilizing AI technology, diagnostics, and predictive models were also mentioned. And also the intergovernment and interagency network is also used to respond to the AMR. So that was the main message. And also the NIFA was also well explained as an agency to fund different research projects. Well, personally, I want to understand more about the project that you just shared, because those projects seem to be very interesting. But for today, if there is any question from the participants, we'd like to take them.
Your presentation. I'm Eunmi Cho from Codex Secretariat. Is there any concrete case where AMR in humans was originated from the production animals, just like a similar case of broiler-associated Salmonella impantis case in Japan? If there is, it will be very helpful in persuading stakeholders like farmers in Korea. Thank you.
Thank you for the question. So we, again, in collaboration with FDA and CDC, we are definitely tracking the connection between from farm to fork, looking at it from the agriculture side, the animal, and individuals. We've had cases where we've tracked it from food into the agriculture, but we have not been able to trace it to people yet. Now, we've identified genes that are related, but in terms of finding the exact organism that the person may have been exposed to. That is still we're doing research now in a longitudinal approach over time to see if there's correlation. But there hasn't been officially any recorded instances where we've identified either from the agriculture or the food directly to person as of right now. But that does not mean it doesn't exist. It just means if the person did not go to the hospital and we did not isolate these particular organisms, there is no way for us to really find out if that was not the one impacted. It's just the data is just not there yet. But we are definitely looking at that as well, which is why we're having all three agencies collaborate together. And then the database that we currently have, whenever there's an outbreak or whenever there's any kind of presence, those get uploaded in the database so that way we can keep track for that trend that I mentioned earlier, so we can continue to look for patterns.
Well, thank you very much for the great presentation. I understand that the strong database is already established and good to hear about the different projects. So for the stakeholders, how this kind of a data or the information can be shared with the stakeholders, that's the important question. So sometimes we are the experts, so we use our own language. So when we communicate with the stakeholders, so farmers and ranchers, it's not always easy to communicate. So the data, information that you're gathering, how do you communicate them to the end users? And what kind of activities or the programs are in place to have the better communication?
Yes, again, thank you. Very good question. So USDA has different approaches that they use. We also have a food safety community outreach program, which is specifically designed to communicate that information at a language that is more even for like young students, not just for high, not like a conference like this where we have people with intellect who understand the science, but we are able to go to the farms. We do community outreach. And as I mentioned earlier, we have a very big component in extension. In our extension divisions, their focus is really to put the information in a way that it can address the stakeholders. So we do have webinars that are being held for different stakeholders. We also have the people doing the research themselves. They are funded to find ways to actually provide that information. And I've had examples where people would do things like surveys. They will go out and do surveys and get information from the stakeholders to find out what is the best approach they can be reached. I've had people who, for outreach purposes, have had town halls where they bring all the ranchers and farmers, and then they have that discussion, they present the data, and especially when we're talking about AMR vaccination, and we do food safety outreach as well, where we between the town hall webinars, and we also have instances where beyond the publications, where we have workshops that are being held. In the workshops, the whole purpose of the workshop is to educate. It's to educate, disseminate that information at a more practical, and that's the thing that I need to emphasize a lot. We take the science and we make it applicable to what they need to use it for. So whether or not it's let's say, for example, we found out that the source of the increase in antimicrobial resistance was in the water system. So if we did discover that it was in the water system, then we will educate for irrigation purposes. What are the areas that could be addressed, or what are the processes that can be used to reduce the irrigation spreading of AMR, or at least antimicrobial resistant genes in certain bacteria. So the approach we use, not to make it too long, the approach we use is to make sure that whatever science we discover in the lab or the facilities is disseminated in a more practical, everyday usage for who needs it to use it.
So is there any other questions? Yes. I think it would be the last question. My name is Suwan Ko from Konyang University. I really enjoyed your presentation. And my question is, your organization, NIFA, is the funding agency for research. And I believe that there can be many different research involving AI. So in utilizing AI, is there any project where AI identify and discover something that human didn't or were not able to be before, so that we can actually reduce the AMR? So utilizing AI, so the challenges that the human beings, the human researchers or the human stakeholders were not able to address, are there any direction for your organization utilizing AI technology so that the address the challenges of AMRs can be addressed?
Yes, so we, again, thank you for the question. We are looking at it right now more as to how we can use AI to ask the correct questions. So the way we are looking for trends and looking for patterns, and we're looking for surveillance and monitoring or detection approaches with AI right now, and then trying to let the system learn patterns so we can make decision and intervene. So that's right now the best way we are trying to use it is find ways to create intervention, mitigation approaches, and to reduce the risk. Now, we have not had instances yet, and I said yet because we're still learning how to use the tool, of where there was something that was more prominent for the AI to discover than human, but the analysis, especially of bioinformatics information, genetic information, is definitely making it a lot easier, a lot faster, which give us information to make decision a lot quicker. That one is definitely one area that I've noticed we have speed up our ability to answer questions because the analysis is coming a lot faster and we don't have to wait on ourselves to do the analysis, which could take days, weeks, or months. But with AI, we are able to get some of these answers a lot faster.
As for the AMR, can you just share the proportion of the funding that goes to the research project that use AI for the AMR? The proportion of the funding. The proportion of the funding to the research project that includes the AI for AMR. Yes. How much of your funding goes to the project that use AI for the AMR?
For AMR program, which I supervise, once a year we have a notice for applications. And then, for example, this year we had 95 people who submitted, not just for AI, but for AMR projects in general, that covers every aspect of AMR. And then we go to panel, and then research scientists decide on which projects are the best for funding. And our funding range for the US for a 5-year project could go for about $1 million. And then for a project where they're just testing the idea, they're just getting a new concept and they want to try it out, we sometimes will award 300,000 for those projects. And this year, well, I can speak of last year, we funded 5 projects at 1 million, and one of them was an AI related project. And we funded 4 projects that were just starter ideas that people just wanted to see how well it worked. And those were about $300,000 each. So we do fund quite a bit, and we do this every year.
Thank you very much. 예, 감사합니다.
Thank you. With that, we will close for this presentation. Thank you.
네, 이제 세 번째.
Moving on, we will now invite the third speaker. So the third speaker is the Dr. Song Ha-eun. Currently, she is working in the Honam Institute of Biological Resources, or HNIBR, and he got his PhD in Bugyeong University. The topic of her presentation today is AI-driven development of antibiotic alternative antimicrobial peptide and their efficacy against infectious disease. So please. So thank you for your kind introduction. It is indeed a great pleasure and honor for me to make presentation at this GCFA MFDS. Before I begin my presentation, I would like to thank the core researchers of this project, including Insilicozen and also the other universities. So there is a need for discovering and developing the antimicrobial peptides utilizing animals in island. So these are the content of my presentation. So for the AMR increase, this has been the critical global health threat because the increase of the multi-drug resistant organisms, this is caused by the biofilm formation of the bacteria and also the overuse and misuse of antibiotics. So the existing antibiotics do have clear limitations, and we have to have some new therapies. So we looked at the island and coastal biodiversity. Because islands are characterized by high endemism, meaning that they are home to unique species found nowhere else on Earth. And also peptide, we believe this could be an effective alternative for the antibiotics, especially the antimicrobial peptide. It could work not just against bacteria, but also fungi and also other organisms. And also it forms the resistance in a very rare manner. And peptide has been already commercialized, not just for the medicinal products, but also for the cosmetics and the functional products. So recently, as you see, the Mgallery and also the Mgallery, these obesity medicines, they also have the peptides. They use the peptides for development. Now, when the host is under a certain situation, they release the peptides for the host defense. So they have the several features. First one is the AMP activity. In other words, it targets the DNA, RNA, and proteins and directly increase the membrane permeability. And also, it has an anti-biofilm formation function. And also, it modulates the immune system, and therefore, there are peptides that are good for immunomodulatory activity. And here you can see the 25 different kinds of the functions that the peptide can provide. And so a single peptide can have multiple functions, as you can see. So in order to discover the peptides, there have been a lot of efforts going on. However, the problem was the time and also cost. So it's very time consuming and also it's very expensive. And also for researchers, there is always an issue of the unpredictability and uncertainty. But with the development of the AI technology, the time and the cost have been reduced significantly. So from 2010 to 2020, AI technology has grown and leaps and bounds. In early 2010, I think one of the biggest issues that we faced was to generate data for omics. and also how we identify the functional genes. So for this research, the numerous data was generated, and based on that big data, AI has been developed, and as a result, the AI prediction technology has also grown leaps and bounds. And by the 2030s, looking ahead, I believe that we will have the era of AI agent, and this could lead to increasing efficiency by 1,000 times and also achieving 90% cost reduction. So first of all, we secure the transcriptome analysis. We do the transcriptome analysis, and then we select the AI-based candidate peptide selection, and then we do the peptide synthesis, and then we do the in vitro and in vivo studies to validate efficacy, to find out the antimicrobial peptide, and this is the research pipeline. So first of all, we secure the transcriptome informations. And then we use the AI for the initial screening of peptide. So usually there are about 150 to 200 peptides identified from one species, but still that's too much for initial screening, and therefore we do the secondary screening. And so through the 3D simulation, we use the molecular docking for prediction, and we can identify 10 to 20 candidate peptides, and then for the selected candidate peptides, we do the validation for functions, and this is the AI analysis workflow. So first we do the sequencing, followed by assembly and annotation, and then we do the peptidization for the sequencing of all the peptides, and also in order to enhance the AI accuracy, we did the biochemical analysis, and then we start the machine learning, and then the molecular docking. So let me talk about some biochemical analysis more. Before we transition to the machine learning, we do the biochemical analysis for the initial screening of the peptide. So first we look at the structure. So as you can see, this helix structure, and peptide has diverse structures, and this kind of alpha helix structure, it is easy to penetrate into the cells, and therefore we selected the alpha helix structure. And also for the hydrophobicity, this is important, and also the Bowman index, this is important, that shows the protein binding potential. And also the CPP, this is to evaluate the ability of peptide delivery. So we did this biochemical analysis to enhance the accuracy of AI model. And then we established the AI model, and for this we first prepared the data set for training. So we first of all collected a lot of data, so from public data and also the 17 literature, and we were able to secure the 23,000 positive samples. And also in order to move away from any kind of bias, we used the both positive and negative samples in a 1-to-1 ratio in order to enhance the accuracy of AI model. And also we did the pangenome analysis, so which integrates the entire set of genes within a species or across multiple clades. And this allows us to identify the evolutionary patterns that a single reference genome would miss. And also we focused on a unique genes that the species only has. And by doing so, we were able to discover the peptides with the unique structures. And we also did the gene expression analysis. And for the gene sequencing, so let's, for example, we apply the stress, including the temperature and the pressure, and we only looked at the sequencing for genes where expression goes up under stress conditions. And then we also evaluated the accuracy of AI models. And the cat booster model, you see that it has the highest accuracy rate, and the other algorithms, again, the accuracy was over 86%. And we use this kind of 7 different kinds of the algorithms and applied that to AI to come up with the first list of the peptide candidates. And then we do the second screening with the molecular docking. So CADD, or computer-aided drug design, was used for this pivotal analysis. And we already know the protein structure and also the peptide sequence, and therefore we opted for the SBDD workflow. And also, once peptides are selected, again, we did the ADMET prediction analysis so that in order to verify the commercial potential and also stability of the peptide. And also for the molecular docking, what's most important was to select the right biomarkers. There are numerous biomarkers, but when we select the biomarkers, we did the in vitro and in vivo studies. And so the cell lines that we used for the in vitro and in vivo studies, and also what type of the analysis we will do. So we first set up the plan and then select the biomarkers, and as a result, we were able to identify more selective peptides. And this is the result. So we use the antibacterial peptides derived from the Hercules calgrani. We started with a massive dataset of the 28,000 CDS sequences obtained through the transcriptome analysis, and then our AI model rapidly narrowed this down to 496 candidates. And then we finally performed the structural simulation to select the top 21 candidates, and then we did the validation with the in vitro and in vivo assays, and 9 highly functional antibacterial peptides were selected. And here you can see, so these are the 21 candidate peptides identified from the Hercules calgrani, and we did the in vitro, in vivo test. So here you can see E. coli, Salmonella, Enterica, Pseudomonas aeruginosa, and also the Klebsiella pneumoniae. So for these 6 gram-positive and gram-negative species were analyzed for susceptibility. And here you can see, so this one, so for the vancomycin and also polymycin, it found that it has an antimicrobial effect equivalent to vancomycin or the existing antibiotics. So we use this for further study. So for this HAC 21, so we name it as Hecarin. And so the existing sequencing is the Hecarin 1, and the modified sequence. So we actually put the acetyl and also the NH2. So this modified peptide is called Hecarin 2, and we did the analysis for Hecarin 1, the original one, and the Hecarin 2, the modified one. So first of all, we did the CD analysis to check whether it has the alpha helix structure or not. And we found that the Hecarin 1 and 2, both of them were found to have this alpha helix structure. And also, again, it was again confirmed of the alpha helix structure. And for the MD simulation analysis, we found that the peptides adhere to cells, and even after the internalization, we check whether the alpha helix structure is maintained after internalization. And so this is the screening of the antimicrobial peptides using in vitro antibacterial assays, and you can see the antimicrobial activity found across different bacteria. And even at very low MIC, we found the antimicrobial activity exists. And we also did the in vitro studies for the antibacterial potential of Hecarin. And so we looked at the bacterial motility, and there was a severe inhibition of the bacterial motility. And also we did the TEM analysis. And if you look at the control group, both Salmonella and also the aeruginosa, you see that the cell membranes are maintained well. But then with the Hecarin 1, the membranes are disrupted. So this peptide itself can target and kill the microorganisms. So we were able to check that MOA, and also the biofilm inhibition result. So the Salmonella pseudomonas, as you know, these are the microorganisms that form the strong biofilms. But just like the polymyxin, you can see that the hecarin also has some inhibition effects over the formation of the biofilm. So based on the results, we did the 3 different kinds of the animal studies. So we used the mouse, the rodent, and we induced the disease and assessed the efficacy. So first, we used the hecarin 2 to assess the efficacy. So we injected the salmonella and caused the colitis, and after that, we administered the hecarin 2 orally to a mouse. And here you can see, so this pink indicates the mouse administered with the salmonella, and you can see that on par with the ciprofloxacin, the efficacy is pretty strong with the hecarin 2, and the weight was recovered. And also, if you look at the length of the colon, you can see that again it's recovered to the original state. And also for the XLD agar analysis, you can see that when there is a colony being formed, and it is presented in black, but here you can see the colony formation is inhibited by this substance. And also utilizing the Pseudomonas aeruginosa, so we intentionally created a injury in animals. And the Pseudomonas aeruginosa, this is an organism that slows down the wound healing. So for the PBS treatment group, you can see that even by day 14, there is no wound healing. But hecarin 1, just like the polymyxin, it has a great efficacy for wound healing. And also it successfully inhibited the colony formation. And this is the final animal study. So this is about the pneumonia. So as for the Pseudomonas aeruginosa, and so this is the main organism for the hospital-acquired infections. And so the polymyxin B, however, has some, polymyxin B is the last result, but it has some toxicity. But even for the pneumonia treatment, you can see that the hecarin showed the improvement in the lung membrane. So here you can see that it's effective for wound healing, pneumonia, and also the enteritis. And this paper is going to be was published in Chemical Engineering Journal this January. So far we only talked about the Hercules cagreni, but we can actually utilize a lot of wild animals for various kinds of analysis. So this is the another types of black-spotted sea slug, and we also derived the peptides from this animal. And this is the results of the in vitro analysis. So here you see the results of the polymyxin B and vancomycin, and you can see that the efficacy is higher or on par. And also the anthoplexial dimorpha-derived peptide. And this is the Astragorgia rubra derived peptide, and we again found that there is a very high level of antimicrobial activity. So utilizing these 3 species, when we did the analysis, we checked what's the actual efficacy and whether AI does the great job in selecting the right candidate. And we found that the performance was great. So this really indicates that AI pipeline works really well. And aside from that, we also use the Iviophora japonica and also the Calligorgia granulosa for peptide exploration, and we also looked at commercial potential. So when we synthesize the peptides, the longer the peptide, the more expensive the cost. And so it could be a significant cost burden for commercialization. And therefore, we only looked at the peptides with the less than 10 amino acid sequence. And we looked at how much antimicrobial activity can be expressed by these peptides, and we found that actually that antimicrobial activity is as high as polymyxin B or even higher than that. So this again indicates that the AI pipeline really works well. And for the 80 different kinds of the wild animals, we are developing the peptides derived from these 80 different kinds of wild animals. So this is the conclusion, that the island and coastal biodiversity is a valuable source of novel antimicrobial peptides against antibiotic resistance, and AI-driven screening accelerates the efficient discovery of new therapeutic candidates. And validated peptides showed strong potential against the multi-drug resistant pathogens. And this approach offers a sustainable strategy for next-generation antimicrobial development. So that concludes my presentation. Thank you very much. So thank you. So to address the AMR, she talked about how we can utilize the island and coastal biodiversity to come up with the novel antimicrobial peptides against the antibiotic resistance. And she showed her results, the research results. So if you have any questions, please raise your hand. I really enjoyed the presentation. I'm from MFDS. I have two questions. First of all, so you utilize the AI to find out and explore the candidate materials, and time and cost saving was pretty significant. So my first question is that in order to do so, do you have to develop your own AI? Or you use the off-the-shelf commercial AI solution? I don't think so. So I think you have to have some technology to develop your own AI system. So that's my first question. And second, you talked about performance and accuracy levels and so on. But for the vitally selected peptides, do you also do the tests for the side effects to human health? Because these should be used for human health. So would there be any kind of side effects that could do harm to human health? Thank you for the question. So we just use, so it's impossible, right now it's difficult to utilize the commercial AI model to do this kind of thing. So that's why we developed our own AI. So when it comes to peptide, we have to derive that from the toxic substances, and therefore we use the toxicity prediction model and machine learning model to come up with the AI model. And this AI model, yes, this is a proprietary model that we developed by ourselves. But I think with the advancement of AI technology, maybe one day we can utilize commercial AI for this kind of development. And second, with regards to the human toxicity or side effects, so for this matter, we haven't done any kind of test yet. But in vitro toxicity was confirmed, was tested. So NIH3T3 cell, so for these general cells, again, we checked the toxicity. And also we did the hemolysis analysis utilizing the lamb blood of the lamb. And after the acute hepatitis, we also did the structural toxicity analysis for the spleen and also the liver. And for the polymyxin B treated group, we found the hepatotoxicity. However, for our peptide group, such toxicity was not found. But this is a kind of preclinical study. So for commercialization, as you mentioned, we have to conduct the clinical study to confirm the toxicity of our substance. And in 2027, we will have the second phase of this project. So in phase 2, we will have various tests for commercialization, for example, formulation and also toxicity studies. So these studies will be done from 2027 in wave 2.
Testing. So I have a question for you. Right now, for the AMP, the peptide, there are a lot of studies. You can find very high performance peptide, but sometimes when you realize these peptides are very long, they are very difficult to synthesize, which limited their applications. So in your perspective, so what do you think AI can help to facilitate the synthesis of this kind of the peptide in the future? Thank you.
So for synthesis itself, so actually this is not my expertise, so I might be the right person to answer this question. But I think that yes, one of the hindrance of the peptide application was the synthesis, especially the longer the structures are very complicated, and so the synthesis was really difficult. But recently, I think the synthesis cost is going down significantly. And also for the Herculeus cagreni, it consists of the 23 amino acid. And the Wegovy and the Mgallery, as you see, they consist of the 36 to 38 amino acid. So in order to reduce the synthesis ratio, so that's why we selected the peptides with less than 10 amino acid sequence utilizing AI. And so from 2027, maybe from 2 mer to 5 mer, I think we can reduce the number of amino acids so that we can identify the peptides that are short but that have great potential for commercialization. And I think AI technology can be utilized to discover that.
혹시 질문 없으시면 제가 한 가지만 좀 여쭤볼게요.
I have a question. So for the antimicrobial peptide, so eventually this should be administered into human body, the final goal. But the peptide can be degenerated by enzymes, as you see. And people do have various kinds of enzymes. So I think you have to take that into consideration as well. So the potential of the degeneration within the body. And also for the gram-positive, gram-negative bacteria, and the peptide really works well against the both gram-positive and gram-negative. But then wouldn't it cause the increase in resistance? Yes, so the peptide, as you mentioned, so this is an original natural sequence, and therefore if it's orally administered, if it's applied on the skin, then it's not a problem. But if it's orally administered, then it could be degenerated within the human body. That's why we developed the Harkarin-2 with the modified structure. So we did the amidation at the C terminus, and also we modified the structure. So this is a kind of to provide an encapsulation of the substance. And so for the mouse model study, we actually orally administered the Harkarin-2 to a mouse for that enteritis study. And also the charge, positive charge and negative charge have to be stabilized in order to maintain the alpha helix structure in a stable manner. And this could lead to the reduction in hydrolysis. So the Harkarin-2 had the higher antimicrobial activity than Harkarin original. And also these peptides, I understand that there are a lot of research, but would there be any issues with regards to resistance? And so for peptides, I think that it has very low possibility to cause resistance. So we have a lot of new medicines being developed utilizing peptide. And for the MDR bacteria, I understand that there is no peptide reported that caused the multi-drug resistance. So we do have a lot of questions, but because of time constraint, we'll conclude session 2 here. I'd like to thank the 3 speakers for their contribution and also all the participants. Thank you very much.
네, 고맙습니다. 이것으로 저희
Thank you very much. With that, I would like to close the session 2. So that was a really good opportunity for us to exchange various ideas and exchange questions and answers. So now it's at 3:05, and we will have 15-minute break, and then we will start at 3:20. So 15-minute break is prepared, and I kindly ask you to join in the survey. I understand that you're ready to receive the survey form as you enter into this venue, and your feedback will be greatly appreciated for the conference in the future. And you can also share your feedback through the QR code on the screen. So those who are joining in this conference online, please feel free to be a part of the survey through the QR code. And the paper form, survey form, can be returned when you leave the venue at the end of the day. So we will start at 3:20. Thank you.
항생제를 올바르게 사용하지 않으면 생기는 내성. 이제는 전 세계가 함께 대응해야 할 중요한 과제입니다. 식품의약품안전처는 글로벌 과제 대응을 위해 2021년부터 매년 식품유래 항생 내성 국제 컨퍼런스를 개최하며 국제사회와 함께 대응 방안을 논의하고 협력을 선도하고 있습니다.
The NIFDS is the organization under the Ministry of Food and Drug Safety to support scientific and technological endeavors for food and drug safety management policies. In recent years, our society has undergone significant changes, including the development of advanced science and technology, such as artificial intelligence and digital technology, and the rapid growth of the biohealth industry. In order to respond to these changes, the NIFDS promotes risk assessment, regulatory review, test and analysis, national research and development based on advanced research facilities, equipment, and experts. With risk assessment, we evaluate the effects of hazards such as heavy metals and benzopyrene on humans when using products for human use and provide safety controls to prevent these hazards. Our review process aims to support life cycle management of safety from development to use to ensure that safe and effective medicinal products, medical devices, functional cosmetics, and dietary supplements are brought to the market. The purpose of test and analysis is to identify the quality of vaccines before distribution and ensures public safety by inspecting illegal foods and medical products. Our institute proactively responds to changes in the social environment and innovative technologies and conducts research and development according to the Food and Drug Safety Management Policy. In addition, we support training of regulatory science experts in food and medical product sectors and successful commercialization of innovative products by providing advice on strategies from R&D to manufacturing for innovative growth of the biohealth industry. In addition, NIFDS has been playing a key role while working with many international organizations, including WHO, FDA, OECD, and building a global level of professional capabilities for reviewing. A healthy life starts with safety. As the national institution leading the regulatory science for foods, medicinal products, and medical devices, we will strive to become one of the best food and drug safety regulation agencies for public health and safety.
항생제를 올바르게 사용하지 않으면 생기는 내성. 이제는 전 세계가 함께 대응해야 할 중요한 과제입니다. 식품의약품안전처는 글로벌 과제 대응을 위해 2021년부터 매년 식품유래 항생 내성 국제 콘퍼런스를 개최하며 국제사회와 함께 대응 방안을 논의하고 협력을 선도하고 있습니다.
The NIFDS is the organization under the Ministry of Food and Drug Safety to support scientific and technological endeavors for food and drug safety management policies. In recent years, our society has undergone significant changes, including the development of advanced science and technology, such as artificial intelligence and digital technology, and the rapid growth of the biohealth industry. In order to respond to these changes, the NIFDS promotes risk assessment, regulatory review, test and analysis, national research and development based on advanced research facilities, equipment, and experts. With risk assessment, we evaluate the effects of hazards such as heavy metals and benzopyrene on humans when using products for human use and provide safety controls to prevent these hazards. Our review process aims to support life cycle management of safety from development to use to ensure that safe and effective medicinal products, medical devices, functional cosmetics, and dietary supplements are brought to the market. The purpose of test and analysis is to identify the quality of vaccines before distribution and ensures public safety by inspecting illegal foods and medical products. Our institute proactively responds to changes in the social environment and innovative technologies and conducts research and development according to the Food and Drug Safety Management Policy. In addition, we support training of regulatory science experts in food and medical product sectors and successful commercialization of innovative products by providing advice on strategies from R&D to manufacturing for innovative growth of the biohealth industry. In addition, NIFDS has been playing a key role while working with many international organizations, including WHO, FDA, OECD, and building a global level of professional capabilities for reviewing. A healthy life starts with safety. As the national institution leading the regulatory science for foods, medicinal products, and medical devices, we will strive to become one of the best food and drug safety regulation agencies for public health and safety.
항생제를 올바르게 사용하지 않으면 생기는 내성. 이제는 전 세계가 함께 대응해야 할 중요한 과제입니다. 식품의약품안전처는 글로벌 과제 대응을 위해 2021년부터 매년 식품유래 항생 내성 국제 컨퍼런스를 개최하며 국제사회와 함께 대응 방안을 논의하고 협력을 선도하고 있습니다.
네, 안내 말씀 드리겠습니다. 시간이 금방 또 흘러갔습니다.
So announcement. Now it's 3:20. So ladies and gentlemen, please take your seats so that we can begin session 3. So for those who are outside the hall, I kindly ask you to come inside and take your seats. Session 3 will begin shortly.
A third session shortly, so please make your way to the venue and take your seats. 자, 이제 곧 세 번째 세션을 시작하겠습니다.
We'll soon begin session 3. So ladies and gentlemen, please take your seat.
네, 다시 한 번 더 안내 말씀.
Ladies and gentlemen, I kindly ask you to be seated for the third session. Those who are outside of the venue, please kindly make into the venue and be seated.
네, 그럼
So now we are going to begin session 3. This session is about data-driven integrated management of AMR in the food supply chain and international cooperation. And 5 presentations are prepared for this session. And just like the previous sessions, we will hear presentations and then we do the Q&A. So for session 3, I would like to invite the moderator. So the moderator is Professor Choi Jong-chan of Jeonbuk National University. He's currently serving as a professor in Jeonbuk National University, and he got his degree in microbiology in Chungbu National University. And he has done a lot of research in the animal AMR and also involved in various kinds of research. So now I would like to turn over the microphone to Professor Choi. Please give him a big round of applause. Thank you for your kind introduction. So good afternoon, ladies and gentlemen. So we are now in session 3, and session 3, so I am the moderator of session 3. For this session, as mentioned by MC, so this is about data-driven integrated management of AMR in the food supply chain and international cooperation, and we have 5 presenters. And unfortunately, 2 of them could not be with us in person, so they will join us online for their presentation. So without further ado, let's begin session 3. And just like the previous sessions, again in this session, after each presentation is over, we will have the Q&A session. So we will entertain maybe 2 to 3 questions for each presentation. So now, let me introduce the first speaker.
So the first speaker is Professor Charlene Wang from China Agricultural University. And Dr. Wang earned his PhD from the Urban University and also serve as a research associate at the same university and also at the University of Virginia. And since then, he has been working for the China Agriculture University College of Veterinary Medicine, and he is the deputy head of the FAO Reference Center for AMR China, and also he served as the deputy head of the key laboratory of AMR of Animal Origin, Ministry of Agriculture and Rural Affairs. And today's topic is shared on the screen would be the surveillance of AMR for food animal and companion animal in China.
Thank you for your kind invitations. And I also want to thank the kind of invitation from the organizer and the help from the secretariat to put all the agendas. So today I will give a very brief introduction about the surveillance of AMR for the food animal and the companion animal in China. So this is my university, China Agriculture University. So right now it's ranking the number 2 in the agriculture science. And also for the my institute, the College of Veterinary Medicine, it has about 120 years history. It was founded during the Qing Dynasty and the Imperial University Peking by the Qing Dynasty. And the current dean is Professor Yang Wang. We also have been recently designated as FAO Reference Center for AMR in China in October 2024. So we also would like to work with colleagues and our different countries in the Asia Pacific regions to study AMR and AMR surveillance. We also have a brand new the Hainan One Health Research Institute for Veterinary Public Health. So it should be opened in later this year, and we hope you have a chance to visit our the brand new reference center. So first, I want to just briefly talk about health and AMR. So the history of antibiotics have been over about 100 years, but the history of the AMR also coming along with the discovery of the antibiotics. So, and the AMR has become one of the major public health crises, and it will estimated annual casualty about 700,000 personnel. So by 2050, it could reach 10 million, and it also caused significant economy loss worldwide. Right now, another issue for this AMR is the drug development significantly behind the emergence of the AMR. From here, you can see since the discovery of the antibiotics, a lot of the superbugs have been emerged and keeping emerging. So in 2026, our research group discovered this colistin-resistant gene AMR, led by Professor Shen, and we also discovered tigecycline-resistant gene TEDx3 and TEDx4. So it is not, I think, apparently, so it won't be surprised there will be new AMR genes emerged in the future. So, and also the antibiotics are less efficient and the options are much more fewer. Right now, like the tigecycline and the colistin become the last resort antibiotics in the clinical treatment. But even for these antibiotics, the resistant genes have become emerging. Right now, so because the extensive usage of the antibiotics and the disinfectants in hospital and animal farmings, which promote the emergence and the transmission of the AMR. So the hospital, farm, community wastewaters has become a center of the exertion of the AMR. And also right now, like in the for the disinfectant and the crop productions, the chemical pesticide, the fungicide also co-promote the dissemination of the AMR. And common bacterial disease in food animals is still the most driving factors of the AMRs. Antibiotics is still the best weapon to combat the bacteria. So antibiotics is still our best options, even when we are facing the AMRs. So that means we have to use the antibiotics smart and wisely. Right now, this is currently the antibiotic usage in per kilo of the animal and aquaculture production, but this data is a little bit old. So since the global action plans in 2016, so most countries have released their own global national action plans, and the usage of the antibiotics have been gradually reduced. But so far right now, like in China, a lot of the high CIA, the clinical important antibiotics has been a lot used, and especially some high HI drugs are still used a lot. So based on our research, we find that some of the some AMR genes are related to the public health, like the NDM, the carbapenemus resistance can spread through the migratory birds, flies, or human contact. And the NDM can also be transmitted among different host animals and backyard farmings. So which means these AMRs can not only be transferred in the large industrial farms, a lot of the mid-size, small-size backyard farms can also transmit this kind of the AMRs. Like the MCR1, the clistin-resistant GC, can also spread widely around the aquatic environment. And from our recent studies, we also find the AMR transmission between the human and pets, which means AMR has been transmitted along our side. And the AMR issue is also a big issue for the foodborne pathogens, especially because most of the humans have very limited exposure to the farm animals, and also very limited exposure to these zoonotic pathogens. But we are facing a lot of threat from the foodborne pathogens. So right now, all of foodborne pathogens have been gradually resistant to all kinds of the antibiotics. Next, I will briefly introduce the AMR surveillance of the food animal in China, because we are also the key laboratory for the Ministry of Agriculture for the AMR surveillance in food animals. So the National Action Plan to combat AMR resistance in China was issued in 2016. Then following next year, the Ministry of Agriculture released the National Action Plan to combat animal AMR issues from 2017. And by 2018, the national campaign for reducing the usage of veterinary antimicrobials in pilot farms, which I believe is also the Chinese pilot version of the renal farms. So by the 2021, so the national campaign for reducing use of the veterinary antimicrobials have been gradually pushed forward to the whole country at the national levels. And we also had a new national action plans to combat AMR in 2021. So right now, because our reference center for the AMR is part of the collaboration between CAU and IVDC. IVDC is the Institute of Veterinary Drug Control, what is the sole governing body for the for veterinary drug usage administration in China, and also responsible for the national surveillance of the AMR in food animal. So there are some key issues like the strictly control the market access, and also standardize the GMP of the veterinary antimicrobials, and also standardize the use of veterinary antimicrobials in farm. So at the registration levels of veterinary antimicrobials, like the HIA and CIA drugs, the antibiotics have been banned for the registrations. Under the growth promotion, antimicrobials has also been banned. And now some either to accumulate and either to develop the cross resistance. So these antibiotics have been gradually banned, used as growth promotion and also the animal clinicals. Also, during the manufacture and the sales of veterinary antimicrobials, so we designed this strictly implementation of the GMP and the GSP, which to regulate the sales and the productions. And also, these are some usage of veterinary antimicrobials, some new regulations during the production stage. And we also issue the evaluation method and standard for the quantification effects to reduce usage of the veterinary antimicrobials to quantify how we can evaluate it's truly have been reduced. And also establish the concept of the scientific breeding and medications through the feeding, prevention, regulation, prudent, and all alternatives, and which is also very closely similar to the concept of the renal farm 5G. And we also issued this certificate for these pilot farms who are already reached the goal for the antimicrobial usage reductions for kind of the incentives, so they have more incentives to participate in this kind of the reduction programs. And we also enhanced the surveillance programs, like some also along with the veterinary antimicrobial residuals. So we are now doing the AMR surveillance, also working on the residual surveillance, trying to identify the risk spots of where these antimicrobials have been heavily used, if this AMU can be related to the AMR. Because for the most national action plans, so some have the AMU data, some have the AMR data, but sometimes you just cannot link them together. So if you want to achieve the better goals, so the connection between the AMU and the AMR is very important. So we have also established the surveillance of the AMR in animal origin organisms, which have been running almost 20 years. So right now we have we have more labs joining right now. So the network have been expanded to more than 30 labs crossing the whole countries, and they are doing regular surveillance every year. So this is our surveillance programs. So for surveillance animals, sample times, bacteria, and drugs. Right now, almost all the major antibiotic drugs have been included in the surveillance system. And we also established a standard SOP for surveillance. Annually, we also provide the workshop and the training course for the AMR and the surveillance. So this is our workshop. So because every year there will be new lab joining and new personnel, so they have to participate in the workshop to get the certificate for them to conduct the surveillance program. We also had a national surveillance network, which is hosted by the Ministry of Agriculture, including the three structures, the database structures, all the major data center, and the data analysis portal. this is our system, but this system is usually just designed for the surveillance programs. So this is how we incorporate data, and the Ministry of Agriculture also have a close collaboration with the FAO, the Inform system, and they annually report their data. And also we conduct the data analysis based on this surveillance program and provide an annual report for the Ministry of Agriculture to make the annual surveillance program for the next years. This is recently summarized the data about the antimicrobial use per ton of the animal product in China. So in about 2014, 2015, it reached the peak. It used about 300 milligrams per ton of animal products. But recently, it has been stable about somewhere 150 to 200, so which have achieved a greater reduction. But also China produced nearly half of the swine meat, poultry, eggs, and some other, even 60% of the aquaculture production worldwide, which means China still use a lot of antibiotics, so which means we have more challenging for further reductions. But through our studies, we do find that the fast rising of the MDR E. coli in the last 5 decades, which is also the fast development period of the in China's histories. So like the MDR E. coli, they're carrying more and more resistance genes. These are some policy changes, like the 2016, the MOA banned the colistin as growth promoter from 2017 after our research group find the colistin resistant gene MCR1, and after 2017 it have a significant effect for the prevalence of the AMR with a great reduction, which means the banning policy that truly works. And also this further data show that colistin resistance of the E. coli from animal and humans have decreased significantly after the banning. And right now, so the prevalence still remains very low, which means the banning of the antibiotics as a growth promoter is a very important policy. These are some further data that supported that the MCR colistin resistance rate, the MCR1 and plasmid prevalence rate have been also significantly decreased. Last, I want to give a brief introduction of the AMR surveillance of the companion animal in China. Well, in China Agricultural University, we have the largest single-body veterinary teaching hospital in China, which hosts more than 100,000 cases annually. So we also closely working with more than 100 local vet hospitals. So we have very strong background to conduct this surveillance program. Right, so this is from our surveillance studies right now. You also can see the antibiotic AMR of the pet-derived E. coli has been gradually increasing in the last 20 years. But right now, so even the pet they're not allowed to use carbapenems, but still have some this kind of the superbugs can be identified in the companion animals, which means there is a closely transmission probably between human companion animal and the humans. And these are some international surveillance system and comparing with China. Same right now, only China has this one of the companion animal AMR surveillance worldwide. This is our surveillance network for the companion animals. So we collect the data from the crossing the whole right now there is more hospitals having joined this surveillance network. This is our surveillance team, and we also have a surveillance website. So we issue a report annually about the AMR in the companion animals, because just like I said before, so most of people have very limited exposure to the farm animals, but they are living with the companion animals every day. So the transmission of the AMR between the human and the companion animals even can have more threats to the human health and the animal health. This is our recent studies, one of the recent studies about the pet, like AMR rate in the Staphylococcus from the pets during 2018 and 2022, because the MRSA is one of also the serious pathogens have this can have threats to the human health and animal health, which is also a zoonotic pathogens. So, under this study published on One Health Advances in 2023. Next, I will just very simply explain how to mitigate the AMR with the One Health approach. So, in 2024 in Rongchang, FAO launched the renal farm programs, and we also joined this program. And also the limitation of the antibiotics are right now the most critical strategies for the AMR tacklings. And this is also the trends of the limitations and banning of the antibiotics worldwide. And next, we need to promote the scientific and sustainable breeding and farming by respecting the nature and also ecology priorities and green development, which is sustainable livestock industries. And also need to establish the biosafety prevention and control programs to reduce the transmission of the disease and major pathogens, and also improve the biosafety awareness. That's another key issue, to limit the transmission of the AMR. And the last, also decreasing the antibiotics use is inevitable, so which means also by the the health management and monitoring, and also the use of drug based on the evidence, and also to enhance the biosafety management, and also use the alternatives. So right now it's urgent to developing the prevention and the control technology for the AMRs, like in the develop the specific antibiotics for animals, and improve the efficacy of the current antibiotics, and also discover the alternatives. Because right now for the natural plants extractives, there's a lot of very useful agent can be used as antibiotic alternatives. So only with this kind of the probiotics, herbal medicines, phages, we can have another more weapons to combat the AMR. And also we need to rational use of the antimicrobial agents by the different combination of the technologies. And also we need to connect the international cooperations on the One Health perspectives. So lastly is also to improve the awareness of the AMR by the rational use, scientific reduction, and withdrawal of the antibiotics. Lastly, I want to have an advertisement for our journals called the One Health Advances. So our journals, we collect the zoonotic disease wider perspectives. So we also would like to have your submission of your latest research. Thank you. That will be all.
Thank you for your nice presentation. Q&A 시간을 가지려고 합니다.
We'd like to have the Q&A session, so if you have any questions from the floor, feel free to share your questions.
예.
It's very interesting, this presentation. I have one question regarding your study in antimicrobial residues. I believe residue is kind of a link between antimicrobial use and antimicrobial resistance. So when you, your data shows certain percentage of product shows it's over maximum residual limit. So it is very easy to deal with over the limit. But under the limit, how do you deal with the data? Do you test further or just stop? Thank you very much.
Yes, one way identify the residual problems, we usually contact the local agency responsible for the agriculture and the food safety, and then they will go back to trace where these residual issues over the limit. So once they identify the risks, so usually the local CDC agency will have working with these kind of local farms to find what's the problems in these farms. Are they just using too much antibiotics, or they didn't follow the certain withdrawal period lines? So this can help us to locate where the issue come from. And also usually like these kind of farms, the local agency also work with them to check if they have the more serious AMR issues. Usually when some farm, the animal farm have the serious AMR issues, they intend will use more antibiotics, which might exceed the limit. So which means they need help to probably go through the proper sanitations or the biosafety measures to reduce the AMR issue and also the pathogen, the bacterial infections. So that's why we use this kind of the residual surveillance combined with AMR surveillance to identify this kind of the risks. Thank you.
예, 감사합니다. 저희 시간 관계상 질문
Well, because of the time constraint, we can accommodate only one more question.
The Cruz, I represent the Codex Alimentarius Commission. First of all, thank you very much for a most interesting presentation, and also compliments for great achievements, also in considering the enormous population that you also have. So I'm impressed with how much you have achieved in recent years. And also very interesting to see that you also address companion animals. I had one question regarding aquaculture. Have you also looked into how to tackle antimicrobial resistance in regard to aquaculture? And a second question, I also wondered whether antimicrobial growth promoters have been banned. Thank you very much.
Okay, thank you. Yeah, very good questions. Yes, aquaculture is another issue because China produces over 60% of aquaculture production worldwide. And in China, for the aquaculture, there is another ministry under the MOA. They are managing all kinds of aquaculture productions. We are mainly responsible for the land animals, but we do aware of the AMR issues in the aquaculture, because in the aquaculture environment, it's even, I think, have more access to the human and the natural environment, because these water bodies are connected, which is each other. So we also identified that the AMR having also is a serious problem in the aquaculture environment. So right now, I believe that the Ministry of the Fisheries in China, they also design this kind of the AMR surveillance programs, because I know that there is another AMR reference center responsible for the aquaculture and fisheries in China, belong to this network. And also right now, for the agriculture issue is that they have a lot of antibiotics are commonly used same as the land animals. So which means, a lot of antibiotics, they didn't work very well in the aquatic environment. So this, which means, so the new drug and the new kind of the formula need to be designed for the aquatic environment to reduce this kind of antimicrobial use. Sorry, what's your second question? Promoter, yes. So in China already banned all antibiotics as growth promoters. So the farmers should follow guidelines, use only as the prevention and the treatments. And also in China, so when all these kind of antibiotics banned as the promoters, you got to have something for the substitute, right? So right now, the herb medicines have been widely used as a part of this kind of the growth promotions. And actually it does work well, but the disadvantage is too expensive. So, and also because right now, so a lot of these kind of herb medicines have been used for the animal farming, and it's even driving up the herb medicine price for the human use. So I believe in the future, like how the herb medicines can be further promoted also in other countries. And because right now most of their farmers, they grow this kind of the herb for medicines only mostly for the human purpose, but it's not enough for the animal use. So if we can expand out the kind of the incentive programs to get more the herb medicine and the natural extractions, so we should help this kind of the growth promotions. Thank you.
Thank you. Nice presentation. Mr. 큰 박수로.
Thank you. Thank you again.
다음 연사님 소개시켜드리겠습니다.
Moving on, let me introduce the next speaker. So next speaker is the Dr. Fraser Broadfoot, and currently he is working at the Veterinary Medicine Directorate in the UK. So he used to be the veterinary surgeon and also senior product manager, building his experience. So, Dr. Broadfoot.
Thank you very much. I hope you can hear me all okay. I'm delighted to be invited to present here, and apologies that I can't be there in person. But yes, thanks for the introduction. As mentioned, my name is Fraser Broadfoot, and I work at the Veterinary Medicines Directorate in the United Kingdom. So we're the government lead for antimicrobial resistance in animals in the United Kingdom. And during this presentation, while legislation does play an important role in the UK as well, what I'm going to focus more on this presentation are some of the non-legislative factors which in the UK have really contributed to some of the reductions in antibiotic sales that we've seen in the UK. But I'll just start by giving you a little bit of context on the UK situation. So this graph shows the important farm animal sectors, livestock sectors in the UK, split by relative biomass, so weight of the animal production. And the reason for showing this is to really highlight that cattle and sheep are a very important contributor to overall biomass, accounting for over 60% of the biomass, followed by poultry at 18%. However, when it comes to antibiotic use, although the ruminant sectors account for about 60% of biomass, they probably only account for around 10% of the antibiotic tonnage used. And then if you're looking at pigs, They account for 10% of biomass, but they probably account for around 50% of the antibiotic tonnage used. So we definitely have differences between our sectors in terms of antibiotic use. So when it comes to the UK situation, this is just a timeline showing the different activities that have taken place in the UK. So as you can see from the timeline, we do have a long-standing activity on antibiotic resistance and on ensuring appropriate antibiotic use. But I'm just going to pull out a few bits that are relevant to this talk. So firstly, in 1993, we started collecting antibiotic sales data. So we've been doing this for a long time, but actually when you look at the reductions, they happened more recently. So just collecting antibiotic sales data on its own wasn't enough to cause the reductions, which I'll show you later, but we have been doing this for a long time. Secondly, in 2013, that was when we first published a One Health 5-year strategy or kind of national action plan. And that brought together the human health, the animal health, and the environment. And I think that was an important thing at the time, because at that time there was a lot of kind of blaming between the human and the animal sectors, with the animal sector saying, well, it's all about use in humans, and in the human sector saying, well, the problem is all about use in animals. So people weren't really working together. So I think having the One Health national action plan did help hopefully ensure that people were being more collaborative and working on their areas of expertise and understanding that everyone's working together on the same issue. This 5-year strategy was then updated in 2019 and updated in 2024. The other thing that I was going to point out from this slide was 2017. That was the first time we published livestock sector targets, and I'm going to talk about this later in the presentation. But yeah, basically the work we do is really underpinned by our 20-year vision and our 5-year national action plan, which I'll talk about. So definitely collecting antibiotic sales and antibiotic use data is really important. Sometimes there's a bit of people use very different terminologies when it comes to antibiotic sales and use. So I'm just going to explain what we mean when we're talking about antibiotic sales and use. So I head up the work we do on monitoring sales and use in animals. When we talk about sales, we're talking in the UK, we're talking about this as earlier in the distribution chain. So the way it works in the UK is that all antibiotics need to be prescribed by a vet. But what will happen is the pharmaceutical companies who authorize these antibiotics will sell into a wholesaler. The veterinary practice will then buy the antibiotics from the wholesaler, and then they will prescribe those antibiotics for use in animals. I mean, sometimes it goes via a feed mill as well for antibiotics in the feed. So sales in the UK context, in our context, represents these sales from the pharmaceutical companies, mostly into the wholesalers or the retailers, whereas use is closer to the end user, and most of our use data actually comes from vet prescription data. So it represents what the vet has prescribed or for use in the animals. So we don't actually get a lot of data directly from the farms themselves. I think that would be the ideal place to get it, but we struggle a bit to get accurate data from farms. So most of our use data comes from the vet data. So this is showing how we present our antibiotic sales data. In this case, this is a metric for food producing animals. So this is the milligram per kilogram metric. This is following the new EU metric, which has been updated recently. Originally, we used the SVAC metric, which was the old PCU metric, but we now use the new metric, which produces a figure that is actually quite a lot lower than the original metric. But the most important thing, this is the trend when it comes to sales of animals and food animals. So you can see in the UK, we've had some significant reductions, particularly during the period of 2014 to kind of 2017. That was when we had our biggest reductions. But overall, if you look at the changes in sales of antibiotics for food animals since 2014, we have seen a 57% reduction in sales for food animals, as this shows. So I think monitoring antibiotic sales is really important. It's often easier and less resource intensive than collecting use data, but the main problem is that a lot of the antibiotics are licensed for multiple species, so we cannot accurately split by species using sales data. But one of the things we can do with sales data is to compare our sales data with our resistance data for food animals, and that's what I'll show you on the next slide. So what we've done here is with the blue line is the same as I showed you on the previous slide. So that's looking at antibiotic sales for food producing animals. In the UK, we also have a resistance monitoring program called the Harmonized Resistance Monitoring Program, where we look at the resistance in slaughter animals, and this is primarily in pigs and in poultry. So what the purple bar is showing is the multi-drug resistant E. coli, which is being collected through this slaughterhouse monitoring. So what we mean by multi-drug resistance is, in this case, is resistance to 3 or more antibiotic classes. But the main thing to point out here is that, as you can clearly see, the sales, when you overlay the sales with the multi-drug resistant E. coli, you can see that it's very much following the same trend. And we did do a publication that showed that it was statistically significant, which would be unsurprising. So demonstrating that what we're doing in reducing sales and use is actually reducing resistance, we've found that that's been a really important motivating factor when we're communicating this to the sectors. So in terms of our 5-year National Action Plan and 20-year vision, our main aim with this is certainly to minimise the risk of AMR transmission to humans, but also to keep antibiotics working in animals. And that's something that we very much focus in on our communications to the livestock sectors, that we're doing this to help preserve antibiotic effectiveness for animals as well as human health. So it's not just about human health. When we define antibiotic stewardship, we include, I know there's a number of different ways in which you can define antibiotic stewardship, but we include 2 key aspects. The first key aspect is disease prevention, which is focusing on all the areas that I'm sure you've discussed it today, like biosecurity, infection control, husbandry, vaccination. So disease prevention is really important, and that's one of our key focuses when we talk about stewardship, particularly on the benefits to the farms of preventing disease, is that you'll have better performance, you'll have reduced losses, reduced mortality, better milk production, better fertility, better environmental sustainability. So all of these things are really important. So we focus a lot on disease prevention, but we also focus on the other element, which is more about responsible antibiotic use, like using the correct drug dose, duration, only using antibiotics when it's appropriate to do so, and then using the lower risk antibiotics, and I'll talk about that in the next slide. And preventative use, or prophylactic use, is another key focus of ours to make sure that it's only used in exceptional circumstance, and that is now within our legislation as well. So when it comes, we've had a very strong focus in the UK on use of these highest priority critically important antibiotics. So we follow, well, obviously there's the 2 lists, so the World Health Organization, well, there's more than this, but these are the ones we tend to focus on when we're communicating it, is the World Health Organization medically important antimicrobial list, as well as the AMEG, European Medicines Agency categorization as well. And I think it's good now that both of these documents agree on which are the highest risk antibiotics. In other words, the 3rd and 4th generation cephalosporins, the quinolones, and the polymyxins. So in the UK, there's been a strong focus in food animals to reduce the use of these critical antibiotics, which I'll talk about how we did it. They account now for less than 0.5% of the total antibiotic sales in food animals. So that was a bit of background. I'm now going to move on to some of the behavior change areas. So one of the questions that we often get is that, if we haven't gone very strongly on the legislation and enforcing the farmers and vets to reduce their use, then how have we managed to do it? And so, I think the key thing is behavior change, and that's behavior change of both vets and behavior change relating to farmers. There are lots of models relating to behavior change, but I was just going to use the reset model to discuss this further, and because many of the elements of this model were evident in the UK journey, and I'm going to focus in particularly on the first 3, which is the rules and regulations, the education, and the social pressure part of it. So one of the things that we did in the UK to try and help with AMR is to get these industry bodies on board. And in the UK, the industry bodies are really, really important because they are trusted by and large, they're trusted by the vets, they're trusted by the farmers, and they're considered legitimate. They're important messengers. So if the industry bodies say they should do something, then people are potentially more likely to do it than just the government saying you need to do something. And what we found was that the first industry body to really get on board was the British Poultry Council, and they developed something called an antibiotic stewardship program. And this started back in 2011. And they were at the time they were spotting that there were some increasing resistance problems, and I think they felt that the real need to basically monitor what was going on and to explain what was going on in terms of antibiotic use. So the British Poultry Council started collecting antibiotic use data, so that involved the vets and the farmers, basically primarily the vets actually collating their data and sharing it with the British Poultry Council. They also put restrictions on preventative use, restrictions on these critical antibiotic use. And one of the key things was that they formed an antibiotic stewardship group. And this is a group that brings together vets, farmers, and other industry stakeholders to talk about responsible antibiotic use. So they formed an antibiotic stewardship group, and they also encouraged every company to develop their own antibiotic stewardship group. And this has really been copied by all the other sectors who've now got their own antibiotic stewardship groups. And what's happened is that the other sectors, the other industry bodies have kind of got involved. And the real benefit of them collecting their own data and getting involved is that they're then demonstrating accountability. They're then owning the narrative, and they can use that data to alongside the resistance data, the disease data, to put in place actions to improve the situation. So getting the industry bodies involved is really, really important. The other thing that we have in the UK that's been beneficial have been farm assurance schemes. So these are voluntary schemes, but they, in many cases, to sell into the major retailers, farms do need to be part of a farm assurance scheme. Actually, the picture hasn't changed there. The main farm assurance scheme, the logo isn't showing, but the main farm assurance scheme is Red Tractor, and this is a farm assurance scheme that represents multiple different sectors. And so these are voluntary schemes that provide standards covering things like food safety, animal welfare, and environmental protection. But they're also been really important in terms of antibiotic resistance. So one example here is that the farm assurance scheme Red Tractor and another scheme called Quality Meat Scotland made it a requirement for the pig farmers to collect antibiotic usage data and to submit it to a central hub. And once it becomes Red Tractor, then the farmers definitely do it because they really need to be Red Tractor in order to sell the product into the major retailers. And some of these farm assurance schemes also have extra requirements for example, requirements for regular health visits. So the vets have to go onto the farms regularly, have to develop health plans that are focused on preventing disease, and also require the farm assurance schemes put in restrictions on the use of critical antibiotics, the highest priority ones, so that they can only be used alongside culture and sensitivity. So these farm assurance schemes for us have been really, really important in bringing about some of these changes. Education is very important. We have a vet platform for vet education. The vets need to have the confidence and the the understanding of what of antimicrobial resistance and what they can do. And there we worked with a body called RCVS Knowledge to develop this online training for vets, which has proved really, really popular. And this is free for anyone in the vet practice team. Importantly, the topics, they do include clinical areas like antibiotic stewardship and infection control, but actually the most popular modules have been those that relate to behavior change and actually communicating with the farmers and how to do this effectively in order to bring about behavior change. These have been the most popular modules on there, which I think is really interesting, and it just shows that there is demand out there from vets on not just on the clinical work, but also on the behavioral change work as well. So the next part of the S of the reset relates to social pressure, and I'll talk about two bits here. One of the bit is benchmarking, and the other one I'll also talk about is target setting. So this is an example. In the UK, we have a system for pigs, which is called the Electronic Medicine Book for Pigs, and that was developed by the industry. We did provide funding as well. And during this system, the producers, mostly with their vet data, they upload their usage data every 3 months onto this particular system. And the one thing that's worked really well is that the system allows for farm benchmarking. So, and it's over 95% of the pig farmers are putting their data into this system. So it's a really representative sample. And so every pig farm in the UK knows their antibiotic use in milligrams per kilogram, and then they also know the average for that particular farm type. I mean, we split the pig farms into different farm types, so they're only comparing like for like. And this has proved to be really, really powerful for the pig sector, because I think a lot of farms, if you ask the farmers, they think what they're doing is responsible, and a lot of the vets, think they're responsible. But it's only really once they see data that they can, try and look at how they compare with their peers, and this can really encourage some of the vet farmer conversations around best practice and improving how antibiotics are used. So farm benchmarking has been really important. Also, the pig sector have introduced a persistent high user scheme where, because what we've found is there's lots of low users, but there's a relatively small number of very high users that are pushing up the overall use. And so the pig sector now target the top 5% of those, and anyone who's in the top 5% needs to do an antibiotic reduction plan and demonstrate that they are reducing the use. So yeah, benchmarking has been really important. So the next slide, this shows, I won't go through all this data because it's clearly too much, but this shows how we present the antibiotic usage data in our annual report. And what we've found is that the sectors that first started collecting this data, which is the meat poultry sector and then the pigs, we found a momentum building up. So once one sector starts doing it, then the other sectors start thinking, well, we need to start doing this too. And so we've seen the momentum really build up. Generally, the sectors that have published data have been rewarded reputationally, and because if you see on the right, you can see there's been some very significant reductions, and that's been once the sectors demonstrate that, then they can really demonstrate that they are being responsible, they are accountable for this particular issue. So it has really helped, has helped the sectors that. It has really helped the sectors that do it. And also the other importance is that we've been able to link the usage with the resistance, as mentioned before. So, often resistances of concern can emerge. And so it's very important that we have the usage data to try and work out whether that could be linked to use or whether there could be other potential causes. And the other important thing about antibiotic use is that it's very difficult to set targets without good antibiotic use data. And so target setting is the next thing I was going to talk about. This was something that we asked all of the livestock sectors to set targets. We did this back in 2016, and it was coordinated by a group called RUMA, who are the Responsible Use of Medicines in Agriculture Alliance. And they formed a targets task force which brought together a vet and a farmer from each of the key livestock sectors. And the idea is that those vets and farmers would then liaise with their wider stewardship groups to set the targets. The targets themselves are intended to be broad. They're not just about reducing antibiotic use, but because there are targets in there about vaccine use, about biosecurity, animal husbandry, all of the things that actually contribute to those reductions. And the idea is that they would be, that focused on disease prevention and responsible reductions. Obviously, you could reduce antibiotic use very quickly, but if they resulted in health and welfare problems and disease problems, then that wouldn't be a responsible way of doing it. So, but anyway, the targets are quite broad, and we've found that they're now in the third set of targets being published. There were a new set that was published just last year, and we've found that it really helps with accountability. Because once they publish the targets, then they are then publicly accountable for delivering on those targets. So I've just got a couple of slides left to finish off. One of the things I did want to highlight is that we do have challenges getting antibiotic use data for some sectors. So the majority of sectors the ones on the left of this graph, we have coverage of around 85 or over 90% coverage. In other words, the percentage of animals from the sector where we have antibiotic use data represented. So what you can see that we have got lower coverage for some of the other livestock sectors like dairy, sheep and beef. And we have had a number of challenges, which I'll just touch on in the next slide. So one of the challenges we have with the dairy, beef and sheep sectors is that there are far more farms, there are far more vets involved. So getting the messaging out is more challenging. They're also less integrated. So they're basically not as, certainly beef and sheep, they're not always farm assured to the same degree. They don't have the strong industry bodies that can get messages out. So actually getting messages out is a lot harder in those sectors. Actually getting the antibiotic use data is a challenge. A lot of vets record this data not in a very standardized fashion, and actually extracting the data and presenting it in a standardized way is time consuming. And I think in the ruminant sectors, because the vets are dealing with so many more farms, it's just a lot more time involved. The other thing is the motivation effect, because I mentioned earlier that the ruminant sectors are relatively low users of antibiotics in the UK. So sometimes I don't think they feel the motivation or the need to collect this data, because they say, well, we're doing really well anyway. Why do we need to put all this time and effort into collecting data? So yeah, some resource issues. And then there's also the data sharing trust issues. I think there's sometimes a lot of suspicion and concern about sharing data. So we're trying to work really hard to improve our collaboration and communication in order to promote the benefits of doing this, and explain that this data isn't going to be used as a stick against the farm. And that's one of the reasons why currently we don't collect farm level data in the UK. It's the industry bodies that collect it, because the farmers and the vets are generally quite happy for the data to go there, and then we just get given the overall national figure rather than individual farm data. So this is my concluding slide. I've put a link here to an FAO publication which goes through some of this in a lot more detail, but I think hopefully I've explained that the reasons behind the reductions in the UK are multifaceted. There's not just one thing. But in general, we have followed more of a voluntary than a legislative approach, and that's by providing leadership and by building relationships with the industry bodies and with the sectors and monitoring the sales, use and resistance data, but then giving the industry collective ownership to act on the issues. And this has included the formation of different sector stewardship groups, as I talked about earlier, the industry collecting their own data and doing their own benchmarking and working together to develop their own targets, which are relevant to that sector as well. We've also got some examples of industry education activities like the Farm Vet Champions that I mentioned, and the importance of farm assurance schemes, which are a requirement to sell into retailers. So although it's not legislation, it almost acts like legislation, because if farmers don't do it, then they won't be able to sell into the major retailers. So hopefully that was a helpful overview, and I'm very happy to take any questions. Thank you.
Thank you for your nice presentation. 죄송한데 시간 관계상.
So we will take just one question because of the time constraint. Any question? So I really enjoyed your presentation. I am from Inje University. My name is Park Hyun-taek. I have one question. So for the veterinary sector in the UK, when it comes to the antibiotics steward, we actually have One Health approach. So the human data must be integrated for One Health approach. But for the veterinary data, so I understand that you do a lot of analysis and integration of the veterinary data, but how much human data is integrated? And also, if there was any difficulty, then in order to create the integrated data with the human health data, what kind of methodology did you use? If you have any good methods, can you please introduce that?
Okay, thank you. Can you still hear me? Because I can't see my screen for some reason anymore, but hopefully you can. Yeah, it's a really good question about the One Health approach and integrating the data. Yeah, in general in the UK, we have separate reports. So we have a animal report reporting sales use resistance, and we also have a separate human report. However, we have tried to integrate the data, and we do every few years. We produce something called a One Health report, which you'll be able to find online, and that we do that by trying to, and in that report we do bring the data together. So the way we've done that for sales and use is that in the human sector they created a milligram per kilogram metric that was broadly comparable with the milligram per kilogram metric that we used for sales data, and so that meant that we could then bring that data together in the report. And then in the resistance side, we put some of the data side by side, comparing the different resistances that are of concern in humans with the data that we get from animals and from retail meat, like for example, some of the fluoroquinolone resistance in Campylobacter data from humans, food and animals we put together in the same graph. But yeah, I agree this is a challenge, and I think this is something we can do more of, and we can learn more of as well. Thanks.
Thank you again. 큰 박수 부탁드리겠습니다.
So big round of applause. Thank you very much.
다음
Moving to the next session, we have three presenters who will be present on the ACT project. And before we hear the presentation, we will share a short video clip for the ACT project, which will take about 10 minutes.
Every day, we rely on antimicrobial drugs or antimicrobials to treat infections caused by microbes, including bacteria, viruses, fungi, and parasites. But what if these microbes started fighting back and the drugs stopped working? You may not have heard about it, but this is already happening. The microbes are resisting. This is called antimicrobial resistance, or AMR. It means that in some cases, common infections can no longer be cured. This is a serious threat to human health. But now that you know, you can help do something about it. AMR happens when microbes are exposed to antimicrobials too often or in the wrong way. As a result of this, some microbes survive because they have developed a defense mechanism to resist the effect of the drugs. These stronger microbes can grow and multiply in the presence of drugs, passing their resistance through their DNA to future generations. Over time, the resistant population increases and the antimicrobials that once killed them no longer work. Microbes can be present in the food we eat, and some of them can make people sick. These are called pathogens. These pathogens can also contain genetic material that enables them to resist antimicrobials. So if we eat food containing AMR pathogens and get sick, the illness can be more difficult to treat. The transmission of AMR microbes to people through food is called foodborne AMR. The overuse and misuse of antimicrobials in food production, along with poor hygiene and improper food handling, contribute to the burden of foodborne AMR. If you grow, produce, process, sell, or eat food, then you have a role to play. That means there is something we can all do to tackle foodborne AMR, whether we are farmers, veterinarians, food producers, or consumers. We can help slow the development of AMR by using antimicrobials responsibly, which means only when needed and as directed by a relevant health professional. We can help prevent the spread and growth of AMR microbes by using good hygiene practices and safe food handling and storage practices. Additionally, thorough cooking can kill pathogens. And if you are a government policymaker or a manager in a food business, you can use the Codex Alimentarius texts on antimicrobial resistance. These provide guidance on how to minimize and contain AMR-related risks along the food chain.
AMR is one of the biggest global health threats, and the ACT project has been supporting Nepal to facilitate the implementation of foodborne AMR codex text, and this is contributing to overall enhancement of food safety and food security in Nepal.
In terms of awareness, we have reached out to youth to disseminate this information throughout the nation.
We need to capitalize on content creation. The World Food Forum Nepal chapter was officially launched in 18 October 2023. 5 of us team members, we wanted this global movement to be a national movement in Nepal as well. We concluded that we wanted to organize a youth-led, youth-targeted AMR campaign.
सम्पूर्णमा नमस्कार, म चाहिँ निष्ठा दवाडी वर्ल्ड फूड फोरम नेपालमा पार्टनरशिप एन्ड कोलाबोरेसन हेर्दैछु.
We gathered youth from across Nepal, from each and every provinces of our country, and we had a very intensive, a very deliberate training of trainers session in which experts from different sectors, including the animal health sector, human health sector, nutrition sector, and as well as from veterinary sector, they came and they delivered very impactful presentations.
AMR is affecting our economy, it is affecting our public health, it is affecting our food system and everything. So that is why it is really important to work on AMR now. We will interact with farmers, we will share information, take their stories, their problems.
Namaste.
हामी चाहिँ सर एक्ट प्रोजेक्टको अन्तर्गतमा AMR क्याम्पेन भनेर एउटा प्रोग्राम भइरहेको छ, त्यसको अन्तर्गत आएको.
We are not only considering them as the task force of the future, but they are the present, and then they are the one who can act as consumer. They are the one who advocates these kind of essential issues in the society, and youth understands the importance of these kind of issues.
यसमा मैले जानेको कुरा चाहिँ बायोसेक्युरिटी चाहिँ एकदम मेजर कुरा हो. यसलाई कसरी हामीले चाहिँ गर्न सक्छौं भन्ने कुरा.
बायोसेक्युरिटीको कुरा भयो, फार्म भित्र चाहिँ नजाऊ, अलिकति नजिकबाट चाहिँ हेरौँ न है.
हुन्छ.
अनि हजुरलाई AMR भनेको चाहिँ कतिको थाहा छ सर?
AMR भनेको चाहिँ खासै जानकारी चाहिँ भएन.
यसलाई चाहिँ अब हजुरले कसरी गर्नुभएको छ? जस्ट यतिकै छोडिदिनुहुन्छ कि जथाभावी अथवा यो त बिरामी भयो भनेर एन्टिबायोटिक चलाउनुहुन्छ?
They are the one who advocates these kind of essential issues in the society, and the way the youth understands the importance of these kind of issues, I think they are the best one to spread out or disseminate the messages.
I'm really excited for this initiative because this initiative is a part of FAO Global, and it is aimed to harness the energy and enthusiasm of youth to transform into more climate resilient and sustainable agri-food system.
In Southeast Asia, where agriculture sustains millions, a hidden challenge is emerging, affecting food, animals, the environment, health, and family well-being. This is the story of Cambodia's fight against antimicrobial resistance and the people leading the change. Antimicrobials, such as antibiotics, are used to treat and prevent diseases in humans, animals, and plants. However, when they are overused or misused, resistant microorganisms are created. As a result, common infections are being made harder to treat. Knowledge about the safe use of antibiotics remains limited among many farmers. And because medicines can be accessed without a prescription, the risk continues to grow.
របស់កសិករពេលដែលសត្វរបស់គាត់ឈឺបាទគឺគាត់ទៅទិញបសុសត្វពីដេប៉ូលក់ថ្នាំហើយយកបសុសត្វនោះគឺទៅប្រើ direct គឺទៅប្រើផ្ទាល់ជាមួយសត្វរបស់គាត់ដោយមិនបានពិភាក្សាជាមួយបសុពេទ្យ
Action is underway in Cambodia, led by the Ministry of Agriculture, Forestry and Fisheries, funded by the Republic of Korea and supported by the FAO. The Action to Support Implementation of Codex AMR Texts ACT project is tackling antimicrobial resistance, a growing threat to health and the environment. Through the ACT project, international food safety guidelines, known as Codex standards, are being put into practice. Surveillance systems are being strengthened and awareness about responsible antibiotic use is being raised. By working with farmers, veterinarians, and key institutions, efforts are being made to enhance food safety, protect public health, and build resilience in Cambodia's agricultural sector.
ឥឡូវខ្ញុំអត់សូវប្រើអង់ទីប៊ីយោទិកទេព្រោះដល់ពេលបានឥឡូវខ្ញុំរៀនពេទ្យសាស្ត្រភូមិមកខ្ញុំបានយល់បានដឹងអីខ្លះឧបមាថាពេលយើងចិញ្ចឹមសត្វហ្នឹងខ្ញុំមុនដំបូងខ្ញុំត្រូវប្រើចេះប្រើថ្នាំប្រើអីខ្ញុំត្រូវប្រើសម្បាក់សាំងត្រូវមានការអនាម័យសម្អាតនៅត្រង់អីហ្នឹងដឹងហើយមិនឲ្យគេមកចិត្តមកអីចឹងពីមុនមកខ្ញុំអត់ដឹងចឹងហើយការលក់ដូរអីក៏វាមានផលចំណេញច្រើនជាងមុនដែរព្រោះឥឡូវយើងផលប្រយោជន៍ពីជ្រូកនឹងមកក៏យើងបានក្រាន់ជាងពីពេលដែលមិនទាន់បានរៀនដែរ
Training, awareness campaigns, and technical guidance are being provided to promote the responsible use of antimicrobials, improve biosecurity, and encourage practical disease prevention.
ពេលខ្ញុំរៀននឹងមកខ្ញុំអាចផ្លាស់ប្ដូររបៀបចិញ្ចឹមដោយសារខ្ញុំប្រើប្រាស់ប្រព័ន្ធជីវសុវត្ថិភាពអនាម័យត្រង់អនាម័យឆ្នូកទឹកឆ្នូកចំណីរៀងរាល់ថ្ងៃធ្វើឲ្យមាន់ខ្ញុំអត់កាត់បន្ថយនៃការឈឺដែរបាទកាលមុនខ្ញុំដឹងថាឆ្នូកទឹកឆ្នូកអីចេះថែមទឹកអញ្ចឹងឆ្នូកចំណីដាក់ឲ្យស៊ីអញ្ចឹងគោះដាក់ឲ្យស៊ីមាន់ចេះតែឈឺឆែកបាំងបិទអត់ចិត្តអញ្ចឹងឆ្កែគោឲ្យវាដើរចុះដើរឡើងអញ្ចឹងហើយអ្នកក្រៅចូលមកឆ្លាញ់អញ្ចឹងចេះឆ្លងជំងឺឥឡូវតាំងពីខ្ញុំបានរៀនខ្លះមកខ្ញុំធ្វើកន្លែងប្រព័ន្ធជីវសុខភាពហ្នឹងទៅធ្វើឲ្យមាន់ខ្ញុំកាត់បន្ថយជំងឺច្រើនហើយការចាំទៅអត់សូវប្រើថ្នាំដោយសារខ្ញុំមានវ៉ាក់សាំងមានអីចឹងណាបងធ្វើវ៉ាក់សាំងវាតាមអាយុកាលផងវា
To date, more than 750 farmers, feed producers, veterinarians, and local officials have been reached. Alternatives to antimicrobial growth promoters have been introduced to over 100 farmers, while more than 300 university students and 400 high school students have participated in activities to raise awareness about antimicrobial resistance.
យើងបានផ្សព្វផ្សាយពីលទ្ធផលនៃការគេឃ្លាំមើលភាពសមស្របប្រឆាំងរោគនៅតាមកសិដ្ឋានចិញ្ចឹមសត្វនៅតាមខេត្តមួយចំនួនហ្នឹងទៅដល់មន្ត្រីការិយាល័យកសិកម្មលោកខាងប្រមាញ់និងនេសាទរាជធានីខេត្តទាំងអស់ហ្នឹងដើម្បីឲ្យពួកគាត់បានយល់ដឹងបន្ថែមពីការប្រើប្រាស់អនុក្រម Codex នេះសម្រាប់ចូលរួមក្នុងការបង្ការការឆ្លងរាលដាលនៃភាពសមស្របប្រឆាំងរោគតាមរយៈការប្រើប្រាស់ផលិតផលសត្វជាចំណីអាហារជាគោលការណ៍រួមមួយថាពួកគាត់មានចំណេះដឹងគ្រប់គ្រាន់និងផ្សព្វផ្សាយបន្តបន្ថែមទៅដល់អ្នកពាក់ព័ន្ធផ្សេងទៀត
ACT also support countries in improving lab capacity and building surveillance systems. Lastly, improving governance. ACT helps countries review and update their regulations to align with international standards and support enforcement of these rules. The ACT project aims to build national leadership and ownership so that countries can continue their AMR effort even after external projects end.
Across Cambodia, new ways of keeping animals healthy and ensuring food safety without unnecessary antibiotics are being adopted by hundreds of farmers. Every step is counted in this effort. Every life is valued. 1 litre at a time, change is being achieved so that better production, better nutrition, a better environment, and a better life can be secured for all, leaving no one behind.
예, 영상.
Well, did you enjoy the video clip? So we can move to the next presentations. So the next presenter is Dr. Myeong-shin Choi. Dr. Choi is serving as the officer for the FAO. He earned her PhD for the pharmaceutical science and worked as a scientific officer with the WHO. So please welcome with a big round of applause.
Chair, for your kind introduction of me. Good afternoon, everybody. It's already late. My name is Myeong-shin Chae, Food Standard Officer in FAO, and I'm also a project coordinator of the ACT project. It is really a pleasure to be here to introduce the ACT project and to share the experience and achievement with you today. Since we are here in Korea and I'm Korean, I will speak in Korean today. 안녕하세요. 저는 최명신.
Well, good afternoon. As introduced, my name is Myeong-shin Choi, and before I talk about the ACT project, I'd like to appreciate the MFDS who enabled the implementation of ACT project in here. As a part of the ODA project supported by MFDS, the ACT project is able to be presented and implemented. So thank you for the support. You already saw the video from the Cambodia and Nepal, and actually we do have other videos. However, because of the time constraint, we were able to share only 2 videos, so I'm sorry for that. And by being involved in this project, I have been engaged with many different activities, but for today, I will be able to share only the key activities because of the time constraint. Well, Codex AMR text is something that you have been listening to many times. So the Codex is the food standard program by FAO and WHO. So when the food is imported and exported, there should be one single standard, which is the Codex standard. About 180 countries are being the member of the Codex standard, and based on the consensus of the member countries, the standard has been developed. The AMR emerged as an issue, so the member countries requested to establish the standard so that we can respond against the AMR. So there are 3 Codex AMR texts established. One is the guideline, and the second is the guideline for the integrated monitoring surveillance of foodborne AMR. And the third one is the code of practice to minimize and contain foodborne AMR. So these 3 are the key codex texts on AMR. And as for the AMR, this is a cross-cutting and cross-border issue. So here the One Health approach is taken. And from the primary production till the consumption, the overall area of the food chain is covered by this document. In 2024, at the UN Congress, there was a high-level meeting on the AMR, and the Codex AMR text were recognized as a useful tool for the AMR response. So last year, at the FAO conference, resolution was adopted, making Codex AMR text to become the significant recognized tool for the AMR response, and the FAO members are recommended to utilize this text. An ACT project is to deliver this standard, meaning that how this Codex AMR text can be implemented at different countries. The Codex text is a high-level text, so it's not easy to implement the text in detail in different countries, so capacity needs to be built. So that's why the ACT project was formulated. It started from 2021, and this year, July, it will be completed. So this presentation is really timely. As you see on the slide, from Latin America, Bolivia, Colombia, and from Asia, Cambodia, Mongolia, Nepal, and Pakistan participated together in this implementation of ACT project. And this is the global project. So the training program and the tools are developed at the global level, and then these are implemented into individual countries. Here, the 6 countries actually implemented them. The environment in individual 6 countries were really different. So FAO's different tools were utilized so that the situation at the country level were assessed and the needed factors are identified, and then the needed support were provided. The monitoring and surveillance and governance, regulatory support, and raise awareness, the 3 pillars will be shared for today. So for the AMR surveillance, why data is important? Yes, the data is important because for the AMR, we need to understand the extent of it. And based on that, we need to establish policy and the target. And that requires data. And the impact of policy also can be assessed only with data. And this data is not easily generated. So the studies need to be planned and the sample collection need to be designed and the samples need to be analyzed at labs and the data need to be collected and analyzed statistically and should be presented in a user-friendly manner, and then those data and information need to be disseminated among the different stakeholders. So at the FAO, for many years, and many different projects were involved to create INFARM. INFARM is International FAO Antimicrobial Resistance Monitoring System. So this is not just a simple digital IT platform, rather it covers the data generation, data collection, and analysis of the data at different countries. So the capacity building for the data part is also included in INFARM. INFARM took many years to be established. Flaming Funds in Britain and ACT project in Korea are the 2 bodies provided most of the support. There was a data core. More than 400,000 data points were provided by more than 49 countries. And in 2025, there was a second data call, and about 800,000 data points were provided. So that was a huge growth, and that was not the end of the story. We have the extension plan for this. And as shared by the Dr. Tanawat's session, there will be the report produced based on the first data call. Well, there is more than INFARM. Countries need to submit the data. And INFARM has a one single data structure. However, we collect many different data from different sectors, for animal health and the human health, the food chain. So many different data are being collected. But at the same time, the individual countries need to submit data for INFARM to do the analysis. So at the country level, the national laboratories conduct the analysis, and then the support was provided through the Atlas tool for the AMR monitoring. So we conducted assessment of the capacity using Atlas out of 5 levels. First level and the second level are the most of the cases that were given and assessed to the individual countries, meaning that the capacity building and enhancement is needed. And to do that job, there was a training for the laboratory so that the laboratories can enhance the capability. And then there was a laboratory network established, and the data system related training was conducted. And quality management training was also given for many years. So now the laboratory can produce reliable data. And from 2023, proficiency testing is done by many laboratories, so the data accuracy has been improved. But that's not the end of the story. The AMR monitoring study needs to be done. So depending on the country's priority, monitoring has been supported. So for Cambodia, more than 800 samples were collected, and 300 samples from Nepal and 500 samples from Pakistan. So they were being analyzed. For AMR monitoring, the capacity or the situation of the countries were different. Mongolia and Pakistan, before the ACT project, there were no AMR monitoring program. So the pilot monitoring program was done with the support. And Mongolia, from 2023, generating AMR data continuously, and the scope of the data has been expanded. For Colombia and Nepal, although there was a limitation, there was a AMR monitoring study, but with the support from us, the study has been scaled up. And for Nepal, the food sector and the animal sector were integrated in the monitoring study. For Bolivia and Colombia, the more fundamental approach was taken. National surveillance plan was produced at Bolivia, and the AMR monitoring just studied. And for Colombia, AMR epidemiological unit was established. So the AMR data generated from different points were all integrated and analyzed, and so such a governing system is now in place. So environment is not working alone. WHO's GLASS, OIS, NMUS, and UNEP are working together in collaboration. WHO, for example, AMU data and AMR data of human, and NMUs, the same data for animal, and in farm, animal and plant unit, AMR residue in environment. So these data were all collected, and in order to establish the global integrated system, these organizations are working together. If that is realized, then the overall AMR pattern at the global level can be identified. So with this support, for individual countries, the AMR can be tested and be monitored. So last year, from 6 participating countries, the data were submitted to the INFARM. So not just the monitoring system at the national level, they also support and provide data to the global monitoring system. And the second part is the governance. When we conduct the AMR activity, it is really important to have the regulation in place to have the sustainability. So as we start the project, whether the country's regulations are aligned with the Codex standard. But there was no information on this. So we created ACT tool. The Codex AMR text recommendations were converted into questions. So the individual countries' regulations, whether they are aligned with the Codex text, where are the gaps? So these kind of things will be identified by this questionnaire. So in the beginning, the experts went to the countries and then support the activities there. However, the countries are now able to use their the questionnaire at their site with the user manual. So 6 countries use this tool so that now we understand the gap between the codex text and their individual countries' regulation. So the recommendations were made to close the gap. And also Mongolia, Bolivia, and Cambodia. For these countries, we supported intensively so that they can work on the country's regulations. For example, for Mongolia, there was no prescription for the veterinary drugs. However, with the support, the regulations and laws were revised. So there is a new provision on the animal drug prescription. So it is mandatory now to have the prescription to buy veterinary drug. And for Bolivia, there was no government body to deal with AMR, but by working together, in order to reduce AMR in agriculture and the animal health sector, the national committee called the CC-RAM is established. So the CC-RAM is leading the efforts to reduce AMR. And also, AMR surveillance and the AMR are incorporated into the country's regulation called Regensa. An e-prescription system is being prepared by accumulating data in the database. For Cambodia, the country has a lot of interest in the medicated feed. So for many years, we were able to identify the areas for improvement for here. So strengthening AMR management in medicated feed is recommended and provided as a recommendation to the government for the regulation. Mongolia, Pakistan, 14 Codex standard clauses are already incorporated into their regulation. So by doing so, the Codex AMR text served as a very good, strong tool to update the regulations in individual countries. And so actually the revision or establishment of a new clauses in the regulations were done in individual countries. And for the raising awareness, I believe it's really important. When we started a project, we wanted to understand how strong the awareness on the AMR and the use of the codex text for the AMR control was. So we understood and identified that the AMR awareness is relatively low and the use of the codex AMR text is not widespread. So brochures, videos, case studies, success stories were discovered, and we actively disseminated this information, and we're doing it now too. ACT project website is the place where the informations are regularly updated, and a webinar series is provided involving experts. So the exchanging different experiences from different countries. So this is done bi-weekly. And in the Latin American continent, the Codex Understanding, 11 webinars were done and the 12th webinar is planned. So the training and knowledge dissemination activities are done continuously. And depending on the stakeholders, the needed information can be different. So the priority target stakeholders are identified for the countries, and then intensive trainings are done for them. And as you see from the Nepal case, the young generation is the target population. And World Food Safety Day or World AMR Awareness Week are also used to our benefit to raise the public awareness. So far, about 500 events were held, attracting 15,000 individuals. They're trained through these meetings. Lastly, we do have a farmyard. One of the most frequently asked question is that, let's say I am a farmer, I am a lab analyst, how can I contribute to the control of the AMR? That's one of the most frequently asked questions. So, food and the food system. In that system, we created 11 important characters. So the challenges they have and expert recommendations and resources that can utilize. So all these things are all put together into this farmyard. So this will open and launch it soon. And the survey results. The understanding and awareness has been increased, and the use of the Codex AMR standard and the text has been widened. So I want to say that the Codex AMR text is really useful tool to manage and control AMR. And by utilizing this tool, we have seen that the foundation has been laid for the AMR control at 6 countries. Then what would be the success? The key to the success? I think the assessment and capacity building were strongly done. However, we didn't stop there. Implementation and AMR monitoring continuously conducted. And people see this achievement and realize that this works. So, although ACT project is supporting individual countries, but still the activities initiated in different countries are now led by the individual country's government. And we cannot do everything on our own. So many different stakeholders from different domains are working together, and that was a strong key to the success of the project. And with that, I'd like to share my presentation till now. Thank you. Thank you very much for the presentation. Because of the time constraint, if there is any one question from the floor, we'd like to accommodate just one question. If not, then I want to ask just one thing. As mentioned during your presentation, inter-laboratory testing or international laboratory testing would be very important for the proficiency testing. For the AMR and the data collection, it's important. But if there is no proficiency testing done, then still the data can be collected. So that can happen. And what's your take on that situation? Well, yes, establishing database is important. However, the quality of the data is really critical. So it's not like the data just is submitted to the Inform. Rather, we use the Atlas tool to assess the situation and the capacity of the individual country, then provide the needed support. FAO AMR Reference Center is located in Thailand, and we are working together with that reference center from 2023. So every year, the proficiency testing is conducted in order to confirm the reliability of data, and that continues. So when we are confident, then the data can be submitted to the Inform. So it took time. And although we do have a good result from the proficiency testing, that's not the end of the story. QC and the continuous participation in the proficiency testing are required in order to control and maintain the quality of data. Thank you for your response.
다음 연사분 소개시켜드리겠습니다.
Now let's move on. So the next speaker is the Topfuntisren Davansren director, and because of his personal reason, another person will speak on behalf of him. So the Via Kavizov, National Project Coordinator, will serve us as a speaker for this presentation. So please welcome him with a big hand.
Let's give a presentation if you are ready.
Okay, good afternoon. My name is Thur. I am National Project Coordinator, ACT Project in Mongolia. I would like to introduce this presentation on behalf of the Mr. Topfuntisren, who is the representative of the Ministry of Food and Agriculture and Light Industry of Mongolia. So, okay, yes, Mongolia is the traditionally nomadic livestock-based country, and population is the only 3.5 million. But the livestock population is almost 60 million. It means livestock population is the 20 times of the human and greater the human population. And you know the Mongolia is the nomadic lifestyle, so is the antimicrobial drugs used relatively low. Something will.
좀 도와주시겠습니까?
Okay. Yes. Okay. Our previous presenter, Dr. Mungshin, presented about the ACT project in generally, so I will skip this slide. And generally, you know, raising awareness and surveillance and governance. ACT project in Mongolia assessed before ACT and beginning of the ACT project and during the ACT project, several assessments we have done. For example, PMP AMR and Atlas assessment, ACT tool, and Atlas risk assessment. Based on this assessment, we planned and implemented the ACT project activities in Mongolia. First one, raising awareness. I would like to say something because in Mongolia, in generally, AMR issue and AMU and codex standards was relatively new topics. So everything is started newly. For example, the raising awareness activities. We conducted more than 100 training sessions and reached out more than 7,000 participants. You can see here veterinarians and herders and farmers, youth and students, and food and government stakeholders included. The percent you can see here. And also one of the teams is the international public awareness. For example, the global World Food Safety Day activities every year we conducted in collaboration with the some projects and also government stakeholders. This one is the last year's activity, Food Safety Science in Action, and we organized many activities during the World Food Safety Day. And wow, World Antimicrobial Awareness Week. beginning of the project until now, we conducted many activities during the WOW celebration, and from the student to the policymakers, many activities we organized in collaboration with the government stakeholders and some of the international organizations, for example, WHO and FAO office in Mongolia. And communication, raising activities, because I told before, everything is started from zero. So main thing is the common understanding of the AMR, AMU, and codex. What is the risk of the AMR? So we translated and shared many activities, the local social media to the global website. You will see the many activities we shared here. And we translated a few handbooks, for example, dairy production, poultry production, and pig production, how to use antibiotics effectively and responsibility. One of the lack of things is that we have no English in all people, so we have to need translate into local language. So we translated these documents, and we received the PWA's permission from the FAO and printed out and distributing it to the relevant stakeholders. And you can see many posters also we translated, FAO and WHO and both many posters translated and printed out and is disseminating and distributed to the herders, farmers, veterinarians, and policymakers and food business operators. And this one is also true. Before the Munxing is mentioned and ACT project, each country brochure we also translated and through the website and social media and by paper. It means common public and all people, professionals will understood what is the ACT project, who is the funding, what is the AMR and what is the AMU, what is the codex, something like that. And many videos also translated, and we developed local video and shared it with the FAO website. You can see here is this documents ACT project in Mongolia is developed and translated and printed, and all these documents disseminated, delivered to the relevant target stakeholders. FAO Atlas assessment, from the beginning of the project, end of the project, we 3 times assessed Atlas tool to relevant laboratories, and we also, all laboratories 2022 is just first stage, now is the 5 laboratories, which is second stage, and 1 laboratory is the third stage. This one is the one of the achievement. The laboratory people are so happy now. And proficiency testing. Also, we don't know, even local, we don't have any surveillance, any proficiency testing. And 2022, we initiated and facilitated the national laboratory to AMR reference laboratory in Bangkok. And now is the 5 to 6 laboratories, every year is the enrolled, and they got some certificates, and 80 to 90% is improved the result. And AMR monitoring and surveillance guidelines. One of the things is we don't have any guidelines methodology before beginning of the ACT project. We translated this document into local language, and got a PWS permission from the HQ and publish it and distribute it to the laboratories. This one is the key fundamental methodology for the laboratories. This one also exactly first time in Mongolia. Laboratory trainings, from the beginning until now, we many trainings organized through the laboratory people and national and provincial laboratory. They have now enough skills and experience. Okay, just one thing I would like to back. Yes. Okay, pilot surveillance. We have done the food producing animals from the 2023 until now. And you can see the, in general, is very low and low level of the resistance. Because Mongolia is just nomadic livestock, not intensive farming. That's also one of the advantages. And we have conducted the pilot surveillance for food products. That one is especially is the semi and fully processed dairy and meat products, as well as the chicken and pork meat, imported and domestic chicken and pork meat. We conducted surveillance, but is the chicken and pork, some resistance is relatively was high. This one is the from imported, and also domestic one is the high. So we have to concern on in the future on that issues. And in farm participation, and also we first time participated because it's the last year we participated in farm training in Bangkok, and focal points trained, and 2025 we first time submitted AMR data to the in-farm system. This one was one of the good achievement and the result of the project. You can see here is the blue, and blue one is the, for example, sensitive and also very low level at the resistance. And we also trying to conduct the not only animal and animal products, also plant products. For example, fungicide resistance study we have done, but no resistance is detected. And also residue, antimicrobial drug residue we conducted, and most of them is the normal, but it's the very few samples have some detected some residue. And quality, antimicrobial drug quality is also important thing. We conducted national and imported antimicrobials quality conducted 2 years, and all antimicrobials at the normal. Okay, this one accept. Governance, and we National Codex Committee, we supported beginning of the project until now. Every year is conducted, and National Codex Committee meeting we supported. And adoption of the Codex standards, because we have translated 12 Codex standards relating to AMR and food safety and veterinary drugs. And first time these standards translated into local language and approved by national standards by Mongolian standard agency. And all the standards we also publish it and distribute it to the relevant stakeholders. A national action plan. And beginning of the project, we supported National Action Plan and many activities included in the National Action Plan. All activities, performance is very good result. That one is the ACT project and other projects result. Yes, AMR. And also now we are developing the new National Action Plan, and ACT project is supported the costing and budgeting for the National Action Plan. Last year in November, from the RAP, our regional coordinator organized this training. And prescription, we don't have prescription before. Now veterinary drug prescription is mandatory. That one is the ACT project, and relevant veterinary agency together developed and approved. Yes, key achievements, already I mentioned it, awareness, many awareness activities we have conducted and many surveillance, for example, AMR surveillance 7 and also residue and drug quality, and 5 study we have conducted, and governance. So just last 2 weeks ago, we joined the Irinoparm Symposium because in the last March, Mongolia joined Irinoparm, and we participated this global initiative of FAO, and now we will try to implement Irinoparm at the farm and herders household level. Okay, we have many achievements, but still we have some challenges. For example, knowledge and understanding of the AMR issue, and also foodborne AMR is not priority political decision makers, and limited intersectoral coordination and lack of finance and so on. Beyond of the ACT project, of course, the awareness activities will be continue, and also surveillance and research activities, it will be continue, and also governance and regulatory, it will be more enforced and implemented. Okay, thank you very much. And finally, I would like to express my sincere appreciation to the Ministry of Food and Drug Safety, because this MFDS is founded of the ACT project, and thank you very much MFDS and people of Republic of Korea. Thank you very much. 감사합니다.
Thank you very much, Mr. However, so we are running out of time, so we have no time to take a question. I'm sorry about that. Would you please give a big hand, please, again? 다음 연사로.
So next presentation will be delivered by Dr. Carlos Manuel Libera Forero, who is working at the Columbia Agriculture Institute. He is specialized in the antimicrobial resistance surveillance and animal health.
Please give us a presentation.
Muy buenos días, muchas gracias por esta invitación. Mi nombre es Mauricio Martínez, médico veterinario, y en compañía del doctor Carlos Manuel Rivera, quien me ha colaborado con la traducción de las diapositivas. Pertenecemos a la Subgerencia de Protección Animal, Dirección Técnica de Inocuidad e Insumos Veterinarios del Grupo de Inocuidad en la Producción Primaria y Pecuaria. Para empezar, en Colombia el ICA cumple un papel fundamental como autoridad sanitaria, responsable de la sanidad animal y de la inocuidad en la producción primaria. Pues como sabemos, este nivel es clave, ya que constituye un primer punto de la cadena alimentaria donde se pueden intervenir para controlar específicamente algunos factores, entre estos pues la resistencia antimicrobiana. Desde el grupo de inocuidad es donde se maneja el Programa Nacional de Resistencia a los Antimicrobianos en Colombia. Antes de la implementación del proyecto ACT, el país presentaba importantes limitaciones, ¿no? Existían realmente pocas actividades de sensibilización, los sistemas de vigilancia eran un poco limitados y no contaban con ese soporte estadístico adecuado, acciones en gobernanza pues eran muy débiles, muy básicas, y las acciones en buenas prácticas y en comunicación de riesgo eran apenas incipientes o estaban empezando. Estos son como los pilares que siempre ha tenido el programa de vigilancia de RAM en el país, que son esos 5 que les acabo de mencionar. Después, o sea, con la implementación ya del proyecto ACT, Colombia logra avances significativos estructurados en esos 5 pilares principales. En el pilar de concientización, se realizaron unas campañas en las radios comunitarias, llegando a un tipo de audiencia donde es bastante difícil la conexión de pronto a internet, y con esta estrategia de radio se logra llegar un poco más a esa población objetivo. También se hace una participación importante en eventos macros que llamamos acá ferias, como una feria que tenemos a nivel nacional, que se realiza en la capital, se llama Agroexpo, en donde obviamente allí confluyen muchos actores, ganaderías, porcinos, el sector de producción primaria. Entonces tiene una audiencia y una asistencia bastante grande, y allí se hizo unas estrategias muy innovadoras en cuanto a esa concientización. Se implementó una obra de teatro, básicamente, que era muy interactiva con el público en general, en donde se comentaban uso adecuado de antimicrobiano y pues lo que es alusivo a la resistencia antimicrobiana. Entonces la gente que no conocía la problemática al menos se llevaba una idea de qué es este riesgo, ¿no?, que hoy por hoy tenemos. Se hace una implementación en un programa a mujeres rurales, donde logramos como agrupar a esa población de mujeres que son como muy líderes allí en el campo, mediante las asociaciones de productores, por ejemplo lecheros o otros tipos de agremiaciones que ellos tienen allí en territorio. Llegamos a ese nicho, a esas mujeres, para que ellas expandieran ese mensaje, pues obviamente en sus predios, en sus fincas. Allí era muy encaminado también a conceptos muy básicos de resistencia a los antimicrobianos y pues lo que era el uso adecuado, ¿no?, uso adecuado que se debería tener con estos antimicrobianos. En el ICA también contamos actualmente con un grupo de extensión rural, que es un grupo donde pues con diversas prácticas y diversas metodologías llegan también a esas comunidades apartadas, y allí logramos introducir también, con ayuda obviamente pues del proyecto como tal, en cuanto a recursos y otras cosas más, pues que llegáramos a esas comunidades también con un mensaje básico, que ellos lo entendieran, de qué es la resistencia y cómo debería ser ese uso adecuado de los antimicrobianos. En cuanto al pilar de gobernanza, pues se fortaleció bastante el marco, digamos, como normativo, la implementación de las herramientas que nos provee el proyecto ACT, como la ruta progresiva para la implementación de la resistencia antimicrobiana en el país. El PMP era una ruta que era trazada con diferentes actividades, es decir, el proyecto hizo en su momento un estudio de la situación actual y se vieron unos puntos en donde deberíamos llegar a un futuro. Entonces, este desarrollo de esta herramienta propició un espacio de reunión, unas reuniones que los manejábamos cada 2 meses o cada 3 meses, dependiendo, y allí nos articulábamos mucho con el sector privado. Entonces se fortaleció mucho esa alianza público-privada y además de las otras entidades de vigilancia. Entonces se creó todo un espacio de gobernanza. También fue muy importante el apoyo regulatorio que también realizó pues, FAO con su proyecto ACT, con la contratación de algunos expertos en la materia, donde se hizo en un momento un mapeo total de la situación que teníamos en cuanto a normativas referentes a RAM o inherentes a ellas, o sea, que tenían que ver en algún momento con la resistencia. Entonces, se tiene un documento bien estructurado, donde pues también nos hicieron algunas recomendaciones que pues el instituto va a comenzar a implementar. Es importante aquí también resaltar, actualmente y muy reciente, en el año 2025 sale una ley, que es la ley 2506, que ya la dicta como tal presidencia, o sea, desde alto nivel de gobierno, en donde nos dicen que debemos darle importancia a nivel nacional a la resistencia antimicrobiana y crear toda una mesa intersectorial, una base de datos de microorganismos multiresistentes y ya comenzar a trabajar en grupo. Entonces, FAO también con el proyecto, gracias al proyecto, nos ha ayudado a comenzar a aterrizar un poco esa normativa y cuáles son todos los cambios que deberíamos comenzar a hacer para que no haya ningún tipo digámoslo así, de mala interpretación o de que intervengamos en otros ministerios, ¿no? Que cada ministerio tenga su alcance, pero también hay que hacer todo un estudio normativo en donde FAO nos está acompañando adecuadamente. En cuanto al el pilar de vigilancia, se desarrollaron unos planes de vigilancia rutinaria cada año, donde ya comenzamos a incluir mucho más población monitoreada. O sea, estábamos antes de un tiempo de la llegada del proyecto monitoreando una sola especie y regularmente hacíamos muy pocos muestreos, o sea, la cantidad de muestreo en esa especie era menor, entonces se aumentó y se fortaleció mucho esos planes de vigilancia. Logramos ya tener datos de porcinos, de pollos, de engorde, de leche y en acuacultura. También aquí fue muy importante el apoyo que nos dio el proyecto con la conformación de la unidad de vigilancia epidemiología para la RAM. Antes del proyecto, la resistencia era manejada desde una sola área dentro de la entidad. Y con el apoyo a esta unidad de vigilancia se hace todo un equipo en donde ya muchas direcciones técnicas de la entidad comienzan a trabajar en pro de resistencia antimicrobiana. Entonces es como ya integramos el área de inocuidad, el área de epidemiología, los laboratorios regionales, los laboratorios específicos para RAM, y los laboratorios nacionales de diagnóstico veterinario. Entonces se hace un gran avance en vigilancia porque pues ya tenemos esos estándares internacionales ahí incluidos en esos planes y se genera un dato de mucha más calidad. En cuanto al pilar de buenas prácticas ganaderas, pues se refuerza básicamente con esas campañas, como ya lo había mencionado, para llegar a la población más vulnerable o población que antes no podíamos llegar. Entonces se llega con esos mensajes de prevención, de bioseguridad, se dan charlas en terreno, donde pues ya se va con un mensaje mucho más ajustado de buen uso de medicamentos. Entonces estas buenas prácticas ganaderas se fortalecieron pues gracias a llegar a ese tipo de territorios. En cuanto al pilar de comunicación del riesgo, hubo unos resultados pues importantes, ya que el equipo experto de FAO con su proyecto nos ayuda en cuanto a la interpretación de esos resultados para comenzar a andar la unidad de vigilancia y que ésta se desarrollara adecuadamente. Nos apoyaron permanentemente, técnicamente, con todos sus conocimientos, y allí esto pues lo que hizo es que nos mejoró mucho la interpretación de esos datos, ¿no? Entonces va a servir mucho para entregar una información mucho más transparente, mucho más confiable y unos resultados con mayor peso y mayor credibilidad. Eso es lo que logramos en cuanto a la comunicación del riesgo. Pues básicamente estos avances han generado un impacto significativo en el país. Colombia ha transitado de acciones ya aisladas hacia un sistema mucho más estructurado, mucho más coordinado, fortaleciendo la capacidad institucional y mejorando esa percepción de riesgo, posicionándonos como un actor activo en la respuesta global frente a la resistencia a los antimicrobianos. Bueno, o sea, acá lo clave o los avances claves fueron ese posicionamiento nacional, ya que la RAM se integra como prioridad y se visibiliza mucho más a nivel de la entidad. Ese liderazgo institucional que se da a conocer con ese personal que ya está comprometido y preparado para todos los retos pues, que implica esta problemática, ¿no? Para trabajar en ello. Ya hay muchas más áreas comprometidas en el tema. La toma de decisiones basadas ya en evidencia, haciendo un uso adecuado de esos datos para transformar ya en políticas y en acciones. Mayor habilidad para responder a los riesgos asociados a la RAM, esa colaboración intersectorial entre las alianzas público-privadas, pues se fortalecen con ese trabajo a lo largo del proyecto, la armonización y la mejora en el manejo de los datos, la alineación con esos estándares internacionales ya de los planes de vigilancia. Los impactos que genera para el país es esa transformación del sistema. Ya se vuelve mucho más coordinado, más específico el trabajo y la labor, cada una de las áreas sabe qué es lo que tiene que hacer. Hay un aumento en los niveles de concienciación, lo que genera pues un cambio ya cultural, ¿no? Ayuda para el desarrollo de un marco regulatorio, ese marco regulatorio que es mucho más estructurado y mucho más enfatizado en lo que va a ser el manejo de RAM. Se crean esas agendas y esas mesas de trabajo, que eso sirvió para aliarnos mucho con ese sector privado y que para que todas las acciones que estábamos haciendo en RAM pues se crecieran, ¿no? Cada uno no las hiciera por aparte, sino que ya fueran mucho más integradas, ¿no? El país ha logrado un posicionamiento internacional y se ha convertido en un modelo de referencia a nivel Latinoamérica. En cuanto a la sostenibilidad como tal del programa, pues es un reto y un compromiso. Dentro de la institución nos queda ese reto de continuar la integración de las áreas dentro de nuestro instituto, dentro de nuestra empresa, fortalecer las acciones regulatorias. Nos han quedado algunas acciones de mejora que muy probablemente vamos a trabajar muy rápidamente, establecer la resistencia antimicrobiana como una prioridad en salud pública. También tenemos aquí reto en cuanto a lo técnico y operacional, sostener y mejorar esa capacidad analítica de los laboratorios, que los laboratorios también crecieron mucho con la ayuda tanto económica como técnica, mantener la capacitación continua del personal. Sabemos que igual el personal está rotando muchas veces en todas las entidades de gobierno, es un problema de todas las entidades a nivel de país, que la rotación del personal, pero asimismo se debe mantener esa capacitación constante para que esto pues no sea un impedimento de continuar con la labor, ¿no? Y continuar con el tiempo esos planes de vigilancia que ya están bastante estructurados, hay que seguirlos nutriendo, hay que seguir creciendo en esa parte. El reto y el compromiso también en esa sostenibilidad, que tal vez es la parte económica la que hay veces es más difícil de sostener en el tiempo esos planes. Entonces trabajar siempre en colaboración continua entre el sector público y privado, que ya nos hemos fortalecido bastante en eso, gestionar todos los fondos nacionales y de apoyo internacional, porque pues con el apoyo internacional se ha crecido bastante, para lograr esas mejoras que hoy tenemos en el programa de RAM. Aquí pues una frase importante, el proyecto ACT no termina aquí. Sabemos que es la base y el compromiso a largo plazo del país, tanto con la salud pública, la inocuidad y la lucha contra la resistencia a los antimicrobianos. Y conclusiones y un camino a seguir que debemos tener en cuenta. Es vital el apoyo técnico, financiero, logístico de la cooperación internacional. Siempre nos hemos nutrido mucho con esto. Debemos también tomar acción mediante los resultados que estamos obteniendo producto de esa vigilancia mejorada. Hay que mantener y pues tal vez siempre en pro de mejora el trabajo interinstitucional y con el sector privado. Es fundamental trabajar constantemente en esa comunicación con el sector salud y con el sector ambiente. fortalecer esa gobernanza. Mediante ese uso de datos que estamos teniendo ahorita con esa conformación de la unidad de vigilancia, hay que enfocarnos en la toma de decisiones, trabajar fuertemente pues, en la parte de gobernanza, en que eso se traduzca en políticas, esas decisiones que tomemos, y mantenernos en constante cooperación con los otros países. Entonces, yo resalto mucho lo que ha sido el proyecto, porque se ha crecido bastante en cuanto ese apoyo jurídico fue muy importante. Siempre lo tuvimos, el apoyo técnico para que arrancara y se pusiera en marcha esa unidad de vigilancia. Siempre estuvo muy presto el equipo técnico de FAO a hacernos la ayuda mediante pues, tutorías virtuales, mediante espacios también presenciales. Realmente pues se resalta mucho y se agradece mucho ese crecimiento producto de este proyecto. Eso es lo que les quería decir, solamente pues agradecerles a todos ustedes la ayuda, un saludo desde la distancia y muchísimas gracias, esperando que continuemos así trabajando como lo hemos hecho a lo largo de todo este tiempo del proyecto.
Thank you. 아쉽게도 연사분의 개인 사정으로 녹화.
Well, unfortunately, we just shared the pre-recorded video clips, so we will not have the Q&A session for this presentation. With that, we close the session. Lastly, before we go, there will be the closing remarks by the MFDS. So that would be the last section of the day. Thank you for your participation. Thank you very much. So now we close the session 3. It has been a quite long hour, so I really appreciate all of you for your participation. So now we would like to invite the Young Lee-jung, Director of the Livestock Product Safety Policy Division at the MFDS, for closing. Please welcome with a big round of applause. Good afternoon. As introduced, my name is Jung Young-lee. I'm the Director of the Livestock Product Safety Policy Division. Well, it has been quite a long day. I really appreciate all of you for participating in this event. So AMR is a cross-border issue that requires the cooperation from different stakeholders globally. And I think everybody here, when you come back to your own country, you're the one who continue to support our activity, our concerted activities for the AMR response. So I really appreciate all of you and also the chairpersons and the speakers. With that, would I like to close the 6th MFDS Global Conference on Foodborne AMR. Thank you. Well, thank you very much. That was the official closing of the event. We have studied from early morning, starting from the opening ceremony and session 1, 2, 3. I really appreciate all of you for staying with us, and I also appreciate the online participants for their presence. Your feedback on the conference will be very much appreciated. So the online participants can scan the QR code here and then share your valuable feedback with us. That will be very much appreciated. And your feedback will help us to better prepare for the future event. Well, if you fill in the survey form, please make sure to return it to the reception desk. Tomorrow we have the second day starting from 10 o'clock, the closed meeting of the experts. So those who are planned for tomorrow's meeting, I kindly ask you to come back at Gallery 3 and 4 before 10 o'clock. So I really appreciate all of you one more time for spending your precious time with us. With that, we'd like to close the 6th MFDS GCFA. Thank you very much. I am Yeonjin Kim, the MC of today's event. Thank you.